Good evening, everyone. Hello. Good evening. Hope I'm audible. Good evening, everybody. Am I audible? I wanted to do coding and get more insight. Good evening. So today we are going to discuss biochemistry. So in biochemistry, we are going to cover the most important topics and previously asked questions. I will try to cover up as much as possible all the previously asked questions. Along with that, I will try to cover up the few important places where frequently questions have been asked. ठीक है, जहां पे भी बहुत बार क्वेश्चन पूछा गया हो तो उसके बारे में हम लोग डिस्कस जरूर करेंगे. ठीक है, सो with that much being said, so welcome to today's session. What we are going to do, as yesterday we did, आज तो में क्या किए थे हम लोगों ने, पहले क्वेश्चन सॉल्व किए और उसके साथ साथ उसका एक्सप्लेनेशन भी पढ़ाई किए थे. So we studied both of them yesterday together. Like that only today also we are going to do. So let's start with the first question. Good evening everybody. All right, so which enzyme deficiency is seen in Tay-Sachs disease? Come on, give me the answer. Arey, good evening bhai, thank you. See, our Dr. Paras is also here. I think sir was taking session ले रहे थे ना भाई. Okay, so the answer is very correct answer. What is that? Hexosaminidase A. The first question answer is hexosaminidase A. So what is Tay-Sachs disease? First, let me explain you people what is Tay-Sachs disease. So we have something called as gangliocytes. What are those? Gangliocytes. Okay, so these gangliocytes, my dear students, these are a combination of three important things. क्या क्या होते हैं तीन चीजें? One is fatty acid, और एक होता है दारू, that is your alcohol basically. So fatty acid plus alcohol plus and one more substance will be there, that is only your oligosaccharide. Oligosaccharide. So these are only called as gangliocytes. All of you are absolutely correct. So that is your answer is A. So these gangliocytes are represented by a letter called as GM. What is that? GM. So GM gangliocytes, इसके अंदर तीन तरीके होते हैं, GM1, GM2 and GM3. ठीक है, so GM2 gangliocytes, what is that? GM2 gangliocytes are metabolized by, what is that? GM2 gangliocytes are metabolized by an enzyme called as hexosaminidase. These are metabolized by an enzyme called as hexosaminidase. Okay, so some people sir directly we can just discuss the question and leave, right? So there are many students who had asked me कि मुझे पूछे थे कि सर आप जब बायोकेम करोगे उसमें प्लीज हमें गो थ्रू विद द लिटिल बिट बेसिक. सो लिटिल बिट क्या पूरा आराम से इन डेप्थ कर लेते हैं जो जो इंपॉर्टेंट टॉपिक्स है. सो वी हैव एन एंजाइम कॉल्ड एज hexosaminidase. What is the name of the enzyme? Hexosaminidase. So a hexosaminidase is divided into two types, hexosaminidase alpha and hexosaminidase B. Hexosaminidase A and hexosaminidase B. So hexosaminidase A deficiency, अगर hexosaminidase नहीं होता है, which one? Hexosaminidase A deficiency, then we'll get a disease called as Tay-Sachs disease. Now, based on this, a lot of questions have been asked. तो मैंने सोच लिया कि सारे डिसीज का एंजाइम डेफिशिएंसी बता ही देता हूं. ठीक है, so the first and most important in this table we have here, what is that? The disease. This side we are going to discuss disease. Okay, then this side we are going to discuss the enzyme deficiency. What is that? Enzyme which is deficient. So the first and most important, Gaucher disease. What is that? Gaucher disease. Gaucher disease is due to deficiency of what is that? Not galacto, it is due to glucocerebrosidase deficiency. What is that? Glucocerebrosidase. What is that? Glucocerebrosidase. Repeat karo bhai. Please repeat everybody. Glucocerebrosidase beta. Glucocerebrosidase beta deficiency will lead to which disorder? That is your glucocerebrosidase deficiency will be Gaucher disease. Okay. So clinical presentation, usually all of these deposition disorders will come with the central nervous system symptoms. Okay. All right. Fabry's disease. Fabry's disease is due to deficiency of galactose galactocerebrosidase. What is that? Galactocerebrosidase. Galactocerebrosidase. इसके अंदर भी दो तरीके होता है, galactocerebrosidase alpha and galactocerebrosidase beta. So Fabry's is due to alpha galactocerebrosidase deficiency. What is that? Alpha galactocerebrosidase. ध्यान से देखो, यहाँ पे दो दो इंपॉर्टेंट वर्ड्स है. यहाँ पे ये हो गया ग्लूको, यहाँ पे हो गया गैलेक्टो. What is that? Galactocerebrosidase. ठीक है, कंफ्यूजन नहीं होना है. Galactocerebrosidase. Krabbe's disease again due to galactocerebrosidase only. Cerebrosidase. But which galactocerebrosidase is the question? That is your galactocerebrosidase beta deficiency will lead to which disease? Krabbe's disease. So PDF of this discussion will be uploaded tomorrow. Under the description only you'll find it. Okay, like yesterday orthopedics has been uploaded, I think. Okay, now Tay-Sachs disease. What is Tay-Sachs disease? That is due to deficiency of hexosaminidase. Okay, hexosaminidase. We have types. Hexosaminidase A deficiency will lead to Tay-Sachs disease, and hexosaminidase beta deficiency will lead to what is that? Yes, hexosaminidase beta will lead to deficiency, will lead to Sandhoff's disease. ठीक है सर, ये कोई बोलने का ये नहीं है. All of you must remember, every year there will be one question which will be usually asked directly. Direct question आता है, Tay-Sachs disease deficiency of which enzyme, Gaucher disease deficiency of which enzyme, Fabry's deficiency of कौन सा enzyme. ऐसे ही direct question आता है. I don't want any of my students to make the mistake. तो एक बार आपके लिए we will do the repetition. तो आप वहीं बैठे बैठे what you will do and tell the disease name and you have to repeat it with me. Okay, यहाँ पे ही सीख लेते हैं. Gaucher disease is due to deficiency of, ध्यान से repeat करो, glucocerebrosidase beta deficiency. Fabry's is due to galactocerebrosidase, but Fabry's galactocerebrosidase alpha deficiency. Then Krabbe's is due to galactocerebrosidase but beta deficiency. Tay-Sachs disease hexosaminidase alpha and Sandoff hexosaminidase beta. So these are the most important questions which is associated with your, what is that, glycolipids. What are these called as? Glycolipids. What are these called as? Glycolipids. These are your glycolipids. Okay, glycolipids. So glycolipids भी दो तरीके के होते हैं. One is called as, yes, gangliosides. One is called as gangliosides and one more is called as cerebrosides. क्या होते हैं? Cerebrosides. तो cerebrosides के अंदर क्या होता है? Any cerebroside अगर स्ट्रक्चर देखोगे उसके अंदर आपको मिलेगा फैटी एसिड, उसके साथ में अल्कोहल, दैट इज योर ग्लिसरॉल. जॉनी वॉकर नहीं है, ग्लिसरॉल होगा वहां पे. एंड अलोंग विद दैट यू विल हैव ईदर ग्लूकोज or you have galactose. Depending upon whatever is there, we will call it as our galactocerebroside or glucocerebroside. Hope everything is clear. समझ में आ गया this question? Everybody clear? यहाँ पे गलती नहीं करोगे ना? Come on guys, tell me quickly. So this is the story of your cerebrosides. Gangliosides already मैंने पढ़ा दिया था. Gangliosides will have, what is that? Yes, fatty acid, अल्कोहल एंड ऑलिगोसैक्राइड. तो यहाँ पे बदलने का क्या होता है, चेंज क्या हो रहा है? फैटी एसिड अल्कोहल दोनों में रहेगा. इफ ऑलिगोसैक्राइड इज देयर उसको बोलते हो गैंग्लियोसाइड. अगर GM1 गैंग्लियोसाइड देखोगे, इट वर्क्स एज अ रिसेप्टर फॉर कॉलेरा टॉक्सिन. ये कहता क्या है? रिसेप्टर फॉर कॉलेरा टॉक्सिन. ठीक है, तो इंस्टेड ऑफ मेकिंग यू बाय हार्ट एंड फेकली दिखाऊंगा कि ये ऐसे ही व्हाट इज द डेफिशिएंसी, 10 क्वेश्चन डालने से बेहतर है आज सारे के सारे चीजों को सिंप्लीफाई करके सीख लेते हैं. सो वंस वी आर डन विद दिस क्वेश्चन, लेट्स गो टू द नेक्स्ट क्वेश्चन. चलिए आंसर करो. ये अल्कोहलिक पेशेंट प्रेजेंटेड विथ मेंटल कंफ्यूजन, गेट प्रॉब्लम एंड ऑप्थेल्मोप्लेजिया, व्हिच विटामिन डेफिशिएंसी इज सीन? जल्दी बताओ आंसर. तो यहाँ पे क्या क्या कंप्लेंट्स है? मेंटल कंफ्यूजन. व्हाट इज देयर? What is there? Mental confusion is there. What is there? Confusion. Yes, 1 second. There is some issue with the OneNote. Just let me open it once again. आएगा मेरा screen आएगा. Just 1 second. One second, guys. is happening to this? 1 second. All right. Sorry for the glitch. So, what is happening here? So, a patient with alcoholic patient came to you with what is that? Mental confusion. What is he coming with? Confusion. What is that? Confusion. Along with confusion, the patient is having a problem with the gait. Loss of gait is called as what? Loss of gait is called as ataxia. क्या बोलते हैं उसको? Ataxia. Okay, so this is a type of confusion which is a global confusion. We'll call it as a global confusion. Ataxia and ophthalmoplegia. The standard mnemonic is GOA. Okay, what is that? GOA. So this is a clinical feature associated with which disease? This is associated with the central vitamin B1 deficiency. All of you are correct. जितने लोग भी आंसर किए हो, that is GOA and B1. You people are absolutely correct. What is that answer? Yes, that is your ophthalmoplegia. Global confusion and ophthalmoplegia and ataxia is a clinical feature of central B1 deficiency. Okay, सुनियो central B1 deficiency. Central B1 deficiency leads to what is that? That is only called as Wernicke's encephalopathy. What is that? Wernicke's encephalopathy. What is that? Wernicke's encephalopathy. Okay, so Wernicke's encephalopathy is caused by the deficiency of B1. What is the cause for this? Cause is alcohol. Cause is what? Alcohol. What is that? Alcohol. Okay, so these are the clinical features of your Wernicke's encephalopathy. Okay, if there is a total matlab peripheral and central matlab totally if there is a deficiency of B1 which occurs both in the central and as well as peripheral, means दोनों जगह में अगर B1 deficiency हो जाता है, so that will leads to which disease? Lead to beriberi. बच्चों क्या होता है? What will it lead to? Beriberi. What will it lead to? Beriberi. Okay, so beriberi के अंदर भी दो तरीके होता है. What is that? That is your गीला और सूखा वाला. What is that? Dry and wet. Yes, beriberi can be dry and wet. Okay, so dry and wet. So this is a very important aspect related to what is that? Wernicke's encephalopathy and beriberi. So that is only your thiamine or B1 deficiency. thiamine और कौन सी विटामिन डेफिशिएंसी? B1 deficiency. चलिए यहाँ पे देखते हैं B9 and B12 अगर कम होता है क्या आएगा पेशेंट को? सर अनेमिया लेके जरूर आएगा. क्या होगा? अनेमिया will definitely be there. And if there is a vitamin A deficiency, eye का clinical feature such as a dry eye, bite hot spot, ये सारे seen with what? They are seen with vitamin A deficiency. So this is the story of your second question. Hope everything is clear. I will go to the next important point. Yes, the Pratyusha says what is that? Sir, Korsakoff syndrome. Korsakoff syndrome के अंदर आता है very good. That is your confabulation. Confabulation का मतलब होता है वो भूल जाता है पहले. Okay, what will be there? सब चीज भूल गए. And after forgetting, वो अपने आप से खुद से what will that? He will create his own memory and he will tell हम वहां गए थे, ये गए थे. False filling of memories is seen with which disease? Yes, seen with your Korsakoff syndrome, that also seen with alcohol only. Okay, चलिए आगे बढ़ते हैं. ये फीमेल पेशेंट कौन है? फीमेल पेशेंट विथ मैक्रोसाइटिक अनेमिया. आंसर बताओ क्या है? मैक्रोसाइटिक अनेमिया एंड होमोसिस्टिन्यूरिया. यूरिन के अंदर क्या बढ़ा हुआ है? होमोसिस्टिन. नॉर्मल मिथाइल मेलानोइट लेवल्स. विच विटामिन थेरेपी कैन हेल्प इन दिस पेशेंट? ओके, पहले देखो क्या दिया हुआ है? मैक्रोसाइटिक अनीमिया. क्या दिया हुआ है? मैक्रोसाइटिक अनीमिया. So now you people will tell me what is that? मैक्रोसाइटिक अनीमिया है तो क्या कौन सी विटामिन डेफिशिएंसी होगा और यहाँ पे क्या देना चाहिए? जल्दी बताओ. लेट्स सी हाउ मेनी ऑफ यू कैन टेल मी द आंसर. हाँ बताओ क्विकली. Yes, all of you are correct. What is that? Pratyusha, Rinkesh, Medlife, all of you are absolutely correct. Macrocytic anemia, and here the correct answer is B. Correct answer is B. Sir, क्यों macrocytic anemia में तो दोनों हो सकता है ना? So you listen to me very carefully. In the macrocytic anemia, what happens is it can be due to B9 deficiency and it can be due to B12 deficiency. दोनों में क्या आएगा? Macrocytic anemia. So macrocytic anemia is always associated with what is that? This is always associated with one more feature will be there, hyper segmented neutrophil. हाइपर सेगमेंटेड न्यूट्रोफिल. हाइपर सेगमेंटेड न्यूट्रोफिल ये होता क्या है सर? कुछ नहीं, बहुत सिंपल, वेरी सिंपल. लिसन टू मी. इफ यू कंसीडर दिस इज अ न्यूट्रोफिल, इनसाइड द न्यूट्रोफिल द न्यूक्लियस विल बी देयर. दिस फेलो न्यूक्लियस विल हैव सेगमेंट्स. न्यूक्लियस विल हैव सेगमेंट्स. यूजुअली कितना होते हैं? यूजुअली 4 से 5 होते हैं, अप टू 6 मैक्सिमम विच कैन बी देयर. कितना हो सकता है? 6 सेगमेंट हो सकता है, बट 6 से बढ़ के ज्यादा सेगमेंट बनेगा. देयर विल बी मोर नंबर ऑफ सेगमेंट. देन क्या आएगा? न्यूट्रोफिल के अंदर हाइपर सेगमेंटेड न्यूट्रोफिल हो गया. सो दैट इज कॉज्ड बाय बोथ B9 एंड B12. सीन इन बोथ ऑफ देम. बोथ B9 एंड B12 डेफिशिएंसी में दिखेगा. बोथ B9 एंड B12 के डेफिशिएंसी में दिखेगा. यस, ओके. तो यहाँ पे B9 एंड B12 को डिफरेंशिएट कैसा करें? सर ध्यान से सुनो. B9 डेफिशिएंसी में देयर विल बी इंक्रीज ऑफ होमोसिस्टिन लेवल. increase of homocysteine level, but normal level of methyl melanoic acid. ये बार बार पूछा जाता है, गलती नहीं करना है. B9 and B12 के अंदर so homocysteine level will be elevated and normal level of methyl melanoic acid. अगर वही B12 में जाके देखेंगे सर, there is a increase of homocysteine, agreed. Increase of homocysteine, agreed, and also there will be increase of methyl melanoic acid. Okay, methyl melanoic acid. अगर दोनों बढ़ गया तो what is that? That is your B12 deficiency. तो याद रखने का एक टेक्निक याद रखो. B12 की कितना है? यहाँ पे नंबर्स 2 नंबर है, दोनों चीज बढ़ा रहता है. 2 numbers are there, both are, so how to remember? In B12 2 numbers are there, both of them will be elevated. You can remember it like this. If both are elevated, B12 deficiency. Very good, all of you are correct. The answer is folate is the answer. ठीक है, जरूरत नहीं है यहाँ पे. There is no need for you to give what is that? B12 in this case scenario. ठीक है सर. B9 and B12 कहाँ काम करते हैं? Why homocysteine level will be elevated? याद रखो B9 and B12. B9 and B12 both take part in conversion of one amino acid. Okay. అవును భయ్యా, తెలుగు వచ్చు మనకి. తెలుగు ఎందుకు రాదు? ఓకే. సో తెలుగు వచ్చు, कन्नड़ बरुत्ते, तमिल तेरियुम, हिंदी बात करता हूँ. आई स्पीक इंग्लिश ऑल्सो. सो यस ऑफ कोर्स. ओके, मतलब 5-6 भाषा बोल लेते हैं. ठीक है. सो B9 and B12 टेक पार्ट इन कन्वर्शन ऑफ समथिंग, इन कन्वर्शन ऑफ that is your homocysteine into methionine. होमोसिस्टीन टू मेथियोनिन में कन्वर्ट होने के लिए कौन चाहिए? बोथ B9 चाहिए and also your B12. Okay, so B9 and B12 both of them are required for the conversion of homocysteine to methionine. अगर B9 and B12 नहीं रहेगा तो homocysteine level बढ़ सकता है. तो इसीलिए डिफरेंशिएट करने के लिए हमें methyl melanoic acid will be used to differentiate between the B9 and B12 deficiency. Okay. अरे FMGs are expert in many things. अपने लोग ना बहुत एक्सपर्ट होते हैं. Okay. Okay, now let's continue to the next same question. It was repeated last, so just 5 years back we met in Kiev airport. Wow, very nice. I think that was the time I was graduating and coming. चलिए, Russian Kaneshna is now Ruski. Now listen to me, macrocytic anemia. Macrocytic anemia, a case with normal methyl malanoic acid and increased level of homocysteine. What is the diagnosis? Just repeat कर दो. I just want you to repeat this question. That is why यहाँ पे लगाया हुआ है. जल्दी quickly comment करो answer. So what will be there? Normal methyl malanoic acid and increased level of homocysteine. What is the deficiency? Yes, sir. Rinkesh Kumar, the answer is yes. Very good. Answer is yeah. Others क्यों comment नहीं आ रहा है? Answer चुप हो गए कैसा? Very good, very good, very good. Okay, so that is a benign deficiency. I am a graduate from Kharkiv National Medical University. Yes, I am a Ukraine graduate, of course. Chalo, let's continue. The next important aspect. A patient suddenly has a chest pain. Which isoenzyme of LDH is elevated? Which isoenzyme of LDH is elevated? पहले आंसर देने से पहले तो हम लोगों को ये काम कहाँ करता है? Let's understand. But before going there, I want you people to give me the answer. Quickly बताओ आंसर क्या है? चलो आंसर बताओ फर्स्ट द नेक्स्ट आंसर लाइक यू नो द फर्स्ट आंसर करो फिर हम लोग ये करते हैं ओके सो लिसन टू मी वेरी गुड आंसर क्या है सर LDH1 आंसर क्या है LDH1 सो लेट्स अंडरस्टैंड LDH का काम क्या होता है कहां रहता है सो लिसन टू मी फर्स्ट एंड मोस्ट इंपॉर्टेंट वी हैव पाइरुवेट रिमेंबर वी हैव पाइरुवेट वी हैव व्हाट इज दैट पाइरुवेट कहां से आया था ग्लूकोज कहां से आया था वेयर डिड द ग्लूकोज कम फ्रॉम द फूड so glucose got converted into pyruvate agar for example if there is no oxygen if there is no oxygen pyruvate will get converted into lactate in the anaerobic glycolysis so this pyruvate to lactate conversion is done by your lactate dehydrogenase enzyme LDH okay agar yahi pyruvate the same pyruvate if O2 is present if what is that O2 is present and also दूसरा भी चाहिए aerobic glycolysis के लिए सिर्फ ऑक्सीजन sufficient नहीं होता है for aerobic glycolysis you require oxygen and mitochondrion both of them should be present only then aerobic glycolysis will take place so this time pyruvate will get converted into that is your acetyl CoA now acetyl coenzyme A will go into Krebs cycle कौन से cycle में जाता है Krebs cycle में जाता है so यहाँ पे glucose to pyruvate glycolysis pyruvate to lactate what is that very good that is anaerobic glycolysis so this LDH enzyme has isoenzymes LDH has a 5 isoenzymes LDH1 LDH2 okay LDH3 4 and 5 LDH3 LDH4 and 5 तो ये क्या होगा आप ध्यान से सुनो whenever patient has a myocardial infarction ये मान के चलो myocardial infarction में ये cardiomyocyte था this is one cardiomyocyte in the myocardial infarction cardiomyocyte is dead so one cardiomyocyte is dead it will release all the contents which is present in the cardiomyocyte so at that time the enzyme whichever is present in the cardiomyocyte will come out so that will present itself as an elevated level that can be used as a diagnostic so LDH1 is located in heart okay and a small amount of LDH2 is also located in the heart LDH4 and 5 they're present in the liver and LDH3 बहुत सारे जगह में होता है but one place so I think it has been taken just check with our team once okay अगर मैं भी एक बार देख लेता हूं मैं भी एक बार अपने टीम से बात करता हूं no issues okay so listen to me LDH3 is said to believed in your what is that said to believed in yes kidney but there is no conclusive proof for that okay so this is the story of your what is that that is your LDH 1 2 3 4 5 and also cardiac markers. So which are all the cardiac markers? अगर ये markers positive है तो मान के चलिए सर myocardial infarction is present. If positive, definitely myocardial infarction is present. So if positive, what are the cardiac markers? Cardiac markers वो एक होता है troponin. What is that? Troponin T. Okay, so troponin T is also used, and we also have CPK-MB, creatine phosphokinase MB form. याद रखो, creatine phosphokinase MB form are also called as creatine kinase, and also this is one more enzyme that will be your LDH1. These are the cardiac markers. ये भी MCQ आ सकता है. All of the following are cardiac marker except करके. Okay. All right. So there is one question. Yes. If you sit for the preparation from now also, yes, you can finish the exam. That is no doubt. Okay. चलो, co-factor for mitochondrial SOD. ये क्वेश्चंस होते हैं गूगली क्वेश्चन. ये कभी प्रिडिक्ट नहीं कर पाओगे बिकॉज ये कहीं कोने में छिपा होगा, टेक्स्ट बुक का कोने में कभी एक क्वेश्चन आ जाता है. सो जस्ट रिमेंबर co-factor for mitochondrial SOD, that is superoxide dismutase. SOD stands for superoxide dismutase. Okay, so this SOD, please listen to me, is the cofactor. What is that? That is your manganese. But बहुत लोगों को एक दिक्कत होता है, सर कोफैक्टर क्या होता है, राइट? सर कोएंजाइम क्या होता है, सर प्रोस्थेटिक ग्रुप क्या होता है? 3 things which will confuse you people. ये तीनों क्लियर कर देते हैं आज. So first and most important, देखो सर coenzyme. What is that? Coenzyme. Okay, so basically let's consider this is one enzyme का structure. This is one, what is that? Enzyme का structure. Let's consider this is the structure of a enzyme. So ये enzyme क्या कर रहा था? Substance A is coming and it is getting converted into substance B. Okay, now इसको मदद करने के लिए, for help of, this is the main enzyme, to this main enzyme organic substances आएंगे. What will be there? Organic substances will come and help. Organic substances will come and help whom? Will help the enzyme. So if organic substance is helping, we call it as a coenzyme, such as your vitamins. Okay, इसी को बोलते हो coenzyme. मतलब main enzyme एक separate entity. Main enzyme is a separate entity. उसको मदद करने के लिए, to help the main enzyme who is coming, organic substance, we will call it as a vitamins, for example. They are called as coenzymes, sir. So the next one we have something called as cofactor. What is that? Cofactor. Okay, cofactor. So what will be there here? Inorganic substances होते हैं. What will be there? Inorganic substances करते क्या है? They are coming from externally. मतलब एंजाइम ऐसा बैठा हुआ है, ठीक है? एंजाइम इज सिटिंग लाइक दिस. कोफैक्टर साइड से आएगा, मान के चलो मैंगनीज आके साइड में क्या करेगा? इट विल बाइंड विद द एंजाइम एंड इट विल इंक्रीज द एक्टिविटी. देन वी कॉल इट एज ए कोफैक्टर. कोई कंफ्यूजन? कॉल्ड एज ए कोफैक्टर. सर और एक होता है, ये बहुत कंफ्यूज कर रखे हम लोगों को, दैट इज ओनली योर प्रोस्थेटिक ग्रुप. अरे प्रोस्थेटिक ग्रुप बहुत सिंपल सी चीज है. प्रोस्थेटिक ग्रुप वेरी इजी टू अंडरस्टैंड. सो प्रोस्थेटिक ग्रुप इज समथिंग विच इज प्रेजेंट विद इन द एंजाइम. ऐसा बोलूंगा तो पक्का ओवरहेड सिंड्रोम. अरे क्या बात कर रहे हो बोलोगे, ठीक है? तो ध्यान से सुनो. ऑल एंजाइम्स आर प्रोटीन. Along with the protein something else will be there. मतलब ये एंजाइम का स्ट्रक्चर था. This is the structure of the enzyme. Within the enzyme के अंदर ही, within the enzyme, inside of the enzyme, I had, for example, iron. Then we will call it as a prosthetic group. Means it is present within the structure of the enzyme, prosthetic group. If it is coming from outside and helping the enzyme, then it is a coenzyme or a cofactor. So if any substance which is present within the enzyme, then we will call it as a prosthetic group. कोई confusion? I hope there is no confusion. Let's continue. ये बहुत बच्चों को confuse होता है. Even during my live classes, many people had asked me, sir ये बहुत confuse हुआ था हमें, can you explain? तो चलो ये आ गया तुम्हारा manganese and the story of your prosthetic group. Okay, very good. चलो आगे बढ़ते हैं. Okay, nitric oxide is synthesized from which of the following? हाँ बता दो जल्दी. Nitric oxide is synthesized from. Okay, I'll add the list of cofactors into the PDF while sharing it. No problem. Okay. Chalo. So all of you are absolutely correct. What is that? That is your B. So all of you are correct. Rinkesh, Pratyusha, Pooja, Anuj, Swarup. Okay. So Rinkesh, Abdul, Krishna. All of you are correct. All of you are correct. What is that? That is your synthesized from your arginine. तो चलिए देखते हैं कैसा होता है. In the smooth muscle. In the smooth muscle. In the smooth muscle. तो क्या होता है? What will be there? Let's understand. एक amino acid होता है arginine. What is the name of the amino acid? Arginine. Arginine under the influence of one enzyme called as NO synthase. What is the name of the enzyme? Nitric oxide synthase. It will create a NO. NO causes the relaxation of the smooth muscle. Relaxation of the smooth muscle. Along with the relaxation of the smooth muscle, by doing what? Smooth muscle by increasing of increase of CGMP. ये भी क्वेश्चन पूछा गया था. Even pharmacology revision maybe I told you people this one. What is that? CGMP. NO synthase will create what is that? CGMP. That will cause the relaxation of the smooth muscle. That is one location, one function. Then the next important arginine plays in urea cycle also. Urea cycle में भी इसका role है. So what is the role of arginine urea cycle? So ध्यान से सुनिए. In the urea cycle, we will have an amino acid called as arginine. Okay, arginine undergoes the influence of an enzyme called as arginase. Under the influence of arginase, तो क्या करेगा? So आएगा क्या आएगा? Arginase. Arginase will do what? Arginase will convert arginine into urea plus what else will be there? Yes, what will be there? Ornithine. What will be there? Ornithine, not citrulline, ornithine. So this is the story of your urea cycle. Arginine का तीसरा काम भी देख लो. Arginine produce vasopressin. Arginine produce vasopressin. Produce what? Vasopressin. So these are the three roles. All of the following except पूछ सकते हैं. Be very very careful. So the answer is B, arginine. Okay. Now we have histidine. Histidine is responsible for the production of, yes, most importantly, what is that? That is a histamine. Okay. And L-hydroxyproline, it is seen in collagen. It is seen in collagen. It is seen in collagen. It is an example for derived amino acid. Derived amino acid. Okay, so this is the story of your, what is that? Story of your nitric oxide and arginine. चलिए आगे बढ़ते हैं. So which of the following is involved in a protein folding? चलो बताओ. What is the answer? Which of the following is involved? So options are chaperone, ubiquitin, proline, and arginine. Okay, so चलो. Come on, quickly tell me the answer. Which of the following involved in the protein folding? So very good answer. Protein folding के लिए कौन चाहिए? Chaperones चाहिए. Okay, पहले ये चेपरी नहीं है, chaperone है. चेपरी नहीं है, chaperone है. So what is protein folding? Yeah, protein folding. So listen to me. We have DNA, right? From the DNA हमें बनेगा mRNA. What is that? mRNA. इसी को बोलते हो आप लोग transcription. What is that? Transcription. Okay, transcription के बाद mRNA will form the protein. mRNA will form the protein. So this process is only called as translation. Formation of protein from the mRNA is translation. So after translation, the proteins will undergo what is that? Modification. What is that? Modification. For example, classically protein folding होता है. What will be there? Protein folding will occur. So the protein folding is done by your, what is that? A modification folding के लिए चाहिए आप लोगों का chaperones, chapri. What is that? Chaperone. Sir, ubiquitin क्या होता है? Ubiquitin will do something called kiss of death. ठीक है? Kiss of death. What do I mean by kiss of death? Basically, it will destroy the proteins. क्या करता है? It will destroy the proteins. We call it as a kiss of death. क्या बोलते हो? Kiss of death. We call it as a kiss of death. So that is destruction of the proteins is done by ubiquitin. मतलब ubiquitin जाके किसी को चुम्मा देगा तो that is end of story. मतलब किसी के साथ जाके ubiquitin kiss किया, that means that is end of that protein story. Protein is going to get destroyed. Okay. Now arginine and proline क्या होते हैं? Arginine and proline, both of them are amino acid. Both of them are amino acid. Yes, ये सारे के सारे PYQ से मतलब क्या? Yes, all of them are PYQs. तो बायोकेम का आपको क्या लगता था? पूरा ऐसा मतलब क्लिनिकल फीचर देके कॉम्प्लेक्स करके पूछेगा, ऐसा कुछ नहीं होता है. 90% ऑफ द बायोकेम क्वेश्चंस कम्स इन दिस पैटर्न ओनली. देयर विल बी सम क्लिनिकल क्वेश्चंस डाउन द लेन वी हैव. ठीक है, डिस्कस करेंगे उन चीज को भी. चलो, लेट्स गो टू द नेक्स्ट इंपॉर्टेंट. विच ऑफ द फॉलोइंग इज नॉट गिवन इन ए केस ऑफ फैटी लिवर डिसीज? ये तो बहुत कॉमन सेंस वाले क्वेश्चन है, इसके लिए तो चलो बताओ व्हाट इज देयर. Which of the following is not given in the case of fatty liver disease? अगर पेशेंट को फैटी लिवर डिसीज है तो क्या क्या चीज नहीं देना चाहिए? Which of the following is not given? Fatty liver disease. Fatty liver disease is a condition where there is a deposition of fat will be there. Deposition of fat will be there in the liver, called as leading to deposition of fat leads to something called as steatohepatitis. Steatohepatitis. So steatohepatitis में क्या हो सकता है? Let me look at the comments. All of you are correct. Yes, the answer is choline नहीं दोगे, मतलब दारू पिला दोगे इस पेशेंट को. Somebody told choline, right? Choline, agar if it was for previous question, that's different. If somebody told choline, choline is not the answer. Please listen to me बच्चों. क्या है? ethanol. दारू दोगे तो क्या होगा? और भी ज्यादा हेपेटाइटिस हो जाएगा. हेपेटाइटिस will increase even more. तो इसीलिए क्या नहीं देना चाहिए? ethanol is not given because that will predispose to steatohepatitis. क्या दे? steatohepatitis. Okay, so that is the story of your next question. चलिए आगे बढ़ते हैं. ये क्वेश्चन क्या है? Which of the following presentation is likely to be absent in this child? Okay, पहले तो ये child का सिनेरियो देखो भैया, क्या डायग्नोसिस से बनाते हैं. And let's look at the option. Which of the following is not seen? Self mutilation tendency, nephrolithiasis, breath holding spells and mental retardation. ठीक है, so कौन सी चीज नहीं रहेगा? Yes, come on, tell me quickly. पहले तो डायग्नोसिस बनाना है, राइट? सो आफ्टर नोइंग द डायग्नोसिस ओनली वी विल बी एबल टू अंडरस्टैंड. ओके, तो पहले तो देखते हैं बच्चे का क्या प्रेजेंटेशन लेके आया है. यहाँ पे देखो उसका क्या हो गया, उसका फिंगर्स, he has bitten his own fingers, he has bitten his own hands, right? And यहाँ पे देखोगे तो there is a bite marks all over the lip. ठीक है, तुम जो bite marks का bite marks में के बारे में बात करते हो that is totally different. यहाँ पे जो bite marks and complete self damage हो गया. ठीक है, so तुम्हारा इमेजिनेशन में जो bite mark है ना वो अलग है भैया. ठीक है, अब वापस आते हैं. So what will be the answer? Come on, tell me quickly. अरे यार क्या हो जाता है मेरे इसमें, कमेंट्स ही नहीं दिखता है. Okay, so answer is if ethanol. Okay, Lichtenhans syndrome. Okay, correct. So somebody says nephrolithiasis is not seen. अरे भैया ध्यान से देखो. So that disease is what? Lichtenhans syndrome. What is that? Lichtenhans syndrome. It is what? Lichtenhans syndrome. Lichtenhans syndrome is a type of X-linked recessive disease. X-linked recessive disease. Okay, this occurs due to what? Deficiency of an enzyme called as HGPRT. What is that? HGPRT कहाँ पे काम आता है? We will discuss in some time. So HGPRT will be deficiency. Due to HGPRT deficiency, if there is a deficiency of HGPRT, that will lead to increase of uric acid. Okay, so this increase of uric acid is only called as what is that? Lichtenhans syndrome. So increase of uric acid will present to the clinical feature with self mutilation very high. Self mutilation is very high with these patients. Okay, self mutilation. Okay, then patient will also have, ध्यान से देखो यार, कभी भी यूरिक एसिड बढ़ेगा तो यूरिया लेवल बढ़ेगा, यूरिया लेवल बढ़ेगा तो यूरिया स्टोन्स हो सकता है ना. In the kidney stones, there are multiple type of stones. What is that? Calcium containing stones. Okay, so there are, for example, lysine stone and uric acid stones also possible. So stones will be present. Nephrolithiasis तो जरूर होगा. अब आ गया आंसर, सही आंसर में आ गए तुम लोग. Once I ruled out the what is that? Nephrolithiasis will be present. Okay, then very good answer. Now you people are catching on. Okay, nephrolithiasis will be present, and also mental retardation will be there. Okay, so what will not be there? That is only your breath holding spells. Breath holding spells are not seen in this case. Okay. Okay, very good. Stone will be present. Stone will be of course present. So breath holding spells नहीं दिखेंगे. Breath holding spells are usually seen with congenital heart defects. Okay, congenital heart defects. Okay, let's continue. So what exactly, where exactly this what will occur, this enzyme will come, let's understand. यहाँ पे ध्यान से सुनो, we have something called as purine metabolism. What is that? Purine metabolism. Purine metabolism. Okay, so when we are speaking of purine metabolism, it occurs by two pathways. One of them is your salvage pathway. One of them is your salvage pathway, and one more is there, that is only called as your de novo synthesis. De novo synthesis मतलब de novo क्या होता है? De novo मतलब नया न्यूक्लियोटाइड्स बनेगा. De novo synthesis. De novo synthesis के अंदर it starts by PRPP. Okay, phosphoribosyl pyrophosphate. PRPP से बनता है. एंड डी नोवो सिंथेसिस के बारे में, दैट इज पीआरपीपी से बनेगा नया वाला. अब ये देखते हैं व्हाट इज दिस xanthine का कहानी. पहले तो ये इमेज देखते हैं आप लोगों को. सर क्या दिखा रहे हो, डरो मत. नाउ प्लीज लिसन टू मी. So this PRPP से what is coming, that is your AMP and all is coming. Okay, but when they're breaking down, when their catabolism, that is your catabolism, breakdown of your, what is that? Yes, breakdown of purine. So what happens? We have adenosine monophosphate, AMP. AMP will get converted into something called IMP. Okay, now this IMP will get converted into ionosine. IMP will get converted into ionosine. अगर adenosine है तो adenosine भी किस में बनेगा? Ionosine में बनेगा. This ionosine will get converted into something called hypoxanthine. ठीक है, hypoxanthine with the help of xanthine oxidase. With the help of xanthine oxidase बनाएगा xanthine and it will create a urea. Okay, and the same thing will come from where? Xanthine will also come from, yes, xanthine will also come from GMP. GMP will get converted into guanosine, guanosine to guanine, guanine to hypoxanthine, hypoxanthine to urea. So basically all of them are getting converted into xanthine to hypoxanthine and hypoxanthine to xanthine, hypoxanthine to xanthine, or guanine to xanthine and urea. Okay, so यहाँ पे एक एंजाइम चाहिए था. What is that? That was your xanthine oxidase. Now what happens in salvage pathway? In the salvage pathway, यहाँ पे देखो ये तो वेस्ट है. xanthine यूजफुल है कि वेस्ट है? जल्दी बता दो. xanthine इज यूजफुल और वेस्ट? क्या वाइट मार्क्स में रहेगा क्या? चलो बताओ जल्दी जल्दी. salvage pathway के बारे में बताने के लिए first important thing we need to understand, xanthine is a useful or waste product now? काम की चीज है कि वेस्ट हो रहा है? इट इज ए वेस्ट प्रोडक्ट. वेस्ट प्रोडक्ट, इट इज गेटिंग कन्वर्टेड इनटू यूरिया. एग्जैक्टली, इट इज गेटिंग कन्वर्टेड इनटू यूरिया. तो सैल्वेज पाथवे में तुम्हारा xanthine, your xanthine and your one more thing, guanine. Okay, xanthine and guanine. Okay, तो ये एक्चुअली वेस्ट में जा रहा था. अब इसको यूटिलाइज करेंगे कैसा? सैल्वेज पाथवे में. सो ये xanthine वापस बनेगा. वापस किस चीज में बनेगा? IMP. xanthine will get converted into IMP and guanine will get converted into guanosine. Guanine will get converted into guanosine. Okay, ये दोनों में conversion होता है. For this conversion we require what is that? HGPRT. See, normally xanthine actually would have, okay, So would have been a waste product actually, but instead of wasting it, हमारे पास क्या है HGPRT. This HGPRT will again make into IMP, will again make into IMP. IMP से फिर से वापस adenosine बना सकते हो. So simple as that. xanthine waste में जा रहा था, उसको वापस लाएगा IMP में by HGPRT, which who is bringing HGPRT. So if HGPRT is not there, so what will happen? HGPRT is not there, will lead to more level of urea, leading to what is that? Lishnihan's syndrome. Okay, then there is a, for example, one more thing is there. If there is a increase of what is that? Purine metabolism, it will lead to which disease? Increase of purine metabolism. हाँ, इंक्रीज ऑफ प्यूरिन मेटाबॉलिज्म होगा तो क्या होगा, बता दीजिए सर, बताओ क्विकली. इंक्रीज ऑफ प्यूरिन मेटाबॉलिज्म ऑटोमेटिकली इंक्रीज ऑफ uric acid. Now this uric acid fellow will get converted into something called as, ये बहुत important MCQ है बच्चों, इसको भूलना नहीं है. Do not make this mistake, please remember. So this is a very very important MCQ. Uric acid will get converted into crystals. What is that? Crystals. Okay, crystals मतलब जो तुम सोच रहे हो वो crystal नहीं है. The crystals are what? Crystals are मोनोसोडियम यूरेट क्रिस्टल. क्या है? मोनोसोडियम यूरेट क्रिस्टल. क्या बन रहा है? मोनोसोडियम यूरेट क्रिस्टल. दिस मोनोसोडियम यूरेट क्रिस्टल अक्यूमुलेट इन द जॉइंट. कहां पे? जॉइंट में अक्यूमुलेट होता है. विल लीड टू व्हाट इज दैट? आर्थराइटिस. विल लीड टू व्हाट इज दैट? आर्थराइटिस कॉल्ड एज गाउट. Okay, so gout बन जाएगा. So gout can be, patient can come with two types of gout. acute gout लेके आएगा. acute gout में क्या क्लिनिकल फीचर्स होंगे देखते हैं सर. acute gout का पेशेंट के अंदर swollen and painful swollen joints. Okay, painful swollen joints. And also remember, patient that is majorly involves the great toe. Okay, so great toe का involvement बहुत commonly होता है acute gout में. And acute gout के लिए drug of choice होता है sir your NSAIDs. What is that? NSAIDs. And also we can use colchicine. What is the name of the drug? Colchicine. Colchicine को यूज कर सकते हो. और we can also use what is that? acute gout के अंदर NSAIDs को यूज करेंगे. Then chronic gout के लिए drug of choice. Yes, chronic gout का drug of choice already आप लोगों ने बता दिए हो. Somebody already typed it also. Medlife I think. So that is your allopurinol. And yes, correct answer both of you. Yes, colchicine and NSAID दोनों यूज कर सकते हो. दोनों में कोई भी यूज कर सकते हो. ठीक है, कोई दिक्कत. Chronic gout के लिए drug of choice will be allopurinol. What is that? Allopurinol. And allopurinol का mechanism of action last few years के अंदर ही, I don't remember exactly which year, but allopurinol का mechanism पूछा था. It is a XO, xanthine oxidase inhibitor. Allopurinol के अलावा you can also use probenecid, and also you can use febuxostat. So these are the drugs which are doing what is that? Used in the chronic gout. So gout and purine metabolism, कोई confusion? Any questions here? सब कुछ समझ में आ गया. लिश्निहान सिंड्रोम, X-linked recessive, self mutilation, mental retardation, nephrolithiasis, done. लिश्निहान, ठीक है. Then we come to the gout के अंदर again patient comes with arthritis. Arthritis can be acute, suddenly pain आ सकता है, or it can be chronic gout के लिए drug of choice is allopurinol, and for acute gout the drug of choice is NSAIDs. What is that? NSAIDs. If that is not there, you can use colchicine. Both of them can be used. And the end of story of your purine metabolism. चलिए आगे बढ़ते हैं. Okay. All right. Which of the following enzyme is found to be deficient in Van Geeker's disease? Which disease? Van Geeker's disease. Okay. What is the answer? Van Geeker's disease. So, जल्दी बता दिया आंसर बताओ. So, it is a type of defect in the glycogen storage disease. It is Van Geeker's is a glycogen storage disease. Glycogen storage disease. Okay, so the enzyme deficient is so very good. Type 1 GSD. Answer is A. All of you correct. Pratisha, Rinkesh, Pooja. Okay, all of you are absolutely correct. Yes, Sai Swarup. ओके साहिल all of you are correct. Yes Abdul, all of you are absolutely correct. तो हम लोग एक काम करते हैं डिसीज एंड एंजाइम डेफिशिएंसी एंड उसके बारे में कुछ और याद करना है तो वी जस्ट लेट्स डू इट क्विकली ताकि हमारा मिस्टेक्स ना हो. प्लीज रिमेंबर. ओके ऑल राइट. यहाँ पे लिखेंगे टाइप टाइप 1 2 3 4. यहाँ पे लिखेंगे डिसीज का नाम. ओके हियर लिखेंगे एंजाइम. हियर लिखेंगे एंजाइम डेफिशिएंट. ओके सो व्हाई एम आई मेकिंग दिस. मैं तो ऐसे भगा के चले जा सकता हूं बट द थिंग इज व्हेन आई गिव यू दिस पीडीएफ आपको लास्ट मिनट में देखना है ना, कहीं इधर उधर भागने की जरूरत ना पड़े. एटलीस्ट देखते पता चल जाए कि तुम्हें क्विकली एक बार पता लाइक यू कैन रिवाइज इट बिफोर. सो टाइप 1. So type 1 is called as 1 Gehrig's disease. 1 Gehrig's disease. It is due to glucose 6 phosphatase deficiency. Glucose 6 phosphatase deficiency. Okay. So यहाँ पे क्या होता है ध्यान से सुनो मेरा बात. So these patients will have hepatomegaly. Okay, hepatomegaly is not a specific symptom. Hepatomegaly can be present with other diseases also. ये सारे accumulation disorder में hepatomegaly आ सकता है. Hepatomegaly, recurrent hypoglycemia are possible. Okay, type 2 disease. Okay, type 2 is due to Pompey's disease. क्या बोलते हैं इसको? Pompey's disease. What do we call it as? Pompey's disease. Pompey's disease is due to deficiency of an enzyme. What is the name of the enzyme? It is due to deficiency of acid maltase. Acid maltase. So यहाँ पे देखो clinical feature थोड़ा अलग होता है. यहाँ पे my dear students, you can get cardiomegaly in the patient. Cardiomegaly. Okay, along with cardiomegaly, patient can also have dystonia. The patient can also have dystonia. मतलब muscles को ज़्यादा तरीके में affect करता है. Okay, so then the next one, what is that? Type 3. Type 3 glycogen storage disorder called as Cory's disease. What is that? Cory's disease. Cory's disease is due to deep branching enzyme deficiency. What is that? Deep branching enzyme deficiency. Deep branching enzyme. Type 4 collagen storage is called as, what is that? That is only called as Anderson's disease. What is that? Anderson's disease. Anderson's disease is due to branching enzyme deficiency. Is due to branching enzyme deficiency. Which enzyme? Branching enzyme deficiency. Type 5. Yes, type 5. Tell me. Type 5 is a McArdle's disease. What is that? McArdle's disease. It is due to hepatic glycogen phosphorylase. What is that? Glycogen phosphorylase. Glycogen phosphorylase. What is that? Glycogen phosphorylase. Phosphorylase, but not the hepatic in McArdle's. Please remember, for McArdle's, for that one, muscular phosphorylase in the muscle. Muscular glycogen phosphorylase. Please don't get confused. Glycogen phosphorylase का कमी होता है, but it is deposited only in the muscles. That is why we call it as a McArdle's disease. Okay. Type 6 is called as Hirsch's disease. Hirsch's disease is also again glycogen phosphorylase only, but glycogen phosphorylase deficiency is occurring with phosphorylase deficiency in, most importantly, in the hepatic, in the liver. So that is a hepatic glycogen phosphorylase deficiency. So that is a disease of Hirsch's disease. Type 7 is there. Type 7 is called as Taury's disease. What is that? Taury's disease. Taury's is due to deficiency of which enzyme? Come on, tell me. Taury's. Taury's is due to deficiency of which enzyme? Hepatic glycogen phosphorylase. Correct. Come on. Taury's is due to deficiency of which enzyme? Yes, deficiency I'm asking. Let's see. So what is this? Taury's is a type 7 glycogen phosphorylase deficiency disorder that is caused as a result of which enzyme? That is only your phosphofructokinase. Okay, PFK deficiency. Okay. So this is a story of your, what is that? This is a story of your, प्लीज रिमेंबर, दैट इज योर ग्लाइकोजन स्टोरेज डिसऑर्डर्स. ठीक है, चलिए आगे बढ़ते, कोई दिक्कत नहीं. सो लेट्स गो टू द नेक्स्ट इंपॉर्टेंट एस्पेक्ट. व्हाट इज दैट? विच ऑफ द फॉलोइंग इज ए कॉम्प्लेक्स 4 इनहिबिटर. भाई साहब ये ना इतना इंपॉर्टेंट है ना, मोस्ट इंपॉर्टेंट क्वेश्चन बार बार पूछा जाता है. कोई दिक्कत नहीं, मैं बता दिया ऑलरेडी. वेरी गुड, दैट इज पीएफके. ओके, एनीवेज मुझे अभी आया तुम लोगों का रेस्पॉन्स, कोई दिक्कत नहीं. नाउ लिसन टू मी, व्हिच ऑफ द फॉलोइंग इज द कॉम्प्लेक्स 4 इनहिबिटर? आंसर ऑप्शंस आर साइनाइड, amibarbital, TTFA, dinitrophenol. What is the answer? So answer will be your complex 4 inhibitor is your very good cyanide poisoning. I know that all of you will give me the answer. Very good. Pratyusha, Pooja, Rinkesh, all of you are absolutely correct. That is your cyanide is a complex 4 inhibitor. So in the electron transport chain, how many complexes we have? 5 complexes. Totally how many complexes? 5 complexes. Among those, which ones? Barbiturates and rotenone inhibit the complex number 1. Okay, malonate inhibit the complex number 2. Carbon monoxide and cyanide poisoning will inhibit what is that? Complex number 4. And oligomycin will inhibit complex number 5. Complex number 5. So this is a very very important point to be remembered. Okay, so TTFA is a complex 3 inhibitor. Amibarbital, remember amibarbital, my dear student, is a barbiturate. It will inhibit complex number 1. And dinitrophenol is nothing to do with the complexes, rather I mean nothing to do with the complex inhibition, but dinitrophenol does one interesting thing. What is that? It uncouples in the electron transport chain only. It will uncouple what is that? Oxidative phosphorylation. Oxidative phosphorylation. It will uncouple oxidative phosphorylation. ठीक है, oxidative phosphorylation. So याद रखो, in the electron transport chain दो reaction होते हैं. 2 reactions will occur. Okay, 2 reactions will occur. What is that? One is oxidation, one is phosphorylation, then ATP will be produced. मतलब ये दोनों साथ में जोड़ी रहते हैं. ठीक है. सो अगर कोई भी दो चीज साथ में है, अगर दो लोग बहुत प्यार से एक दूसरे के साथ है, सो इफ 2 people आर इन लव विथ ईच अदर, ऑटोमेटिकली क्या आएगा? कोई ना कोई होता है जो कौन होता है? बेस्ट फ्रेंड. बीच में आके घुस के क्या करेगा? दोनों को रिश्ता तोड़ देगा. लाइक दैट ओनली डाइनाइट्रोफिनॉल इज लाइक ए बेस्टी बिटवीन दिस ऑक्सीडेशन एंड फास्फोरिलेशन. ऑक्सीडेशन एंड फास्फोरिलेशन. तो किसको अलग कर देगा? ऑक्सीडेशन एंड फास्फोरिलेशन को अलग कर देगा. सो दैट विल लीड टू अनकपलिंग. अनकपलिंग करने से अगर अनकपल हो गया तो इट विल ओनली जनरेट द हीट. ओके, सो इसका अनकपलर्स के लिए वी हैव अदर थिंग्स आल्सो. दैट इज योर एस्पिरिन. And thyroid hormones can also do. A large level of thyroid hormones can also do. Okay, so that is the story of your what is that? Uncouplers. So let's continue to the next question. आगे बढ़ते हैं, चलिए. Okay, which of the following pathways only takes place in a cell cytoplasm? सिर्फ और सिर्फ साइटोप्लाज्म में होना चाहिए. कौन सी ऐसी रिएक्शन है? ऑप्शंस आपके सामने है. ग्लाइकोलाइसिस, बीटा ऑक्सीडेशन, what is that? That is the tricyclic acid cycle, citric acid cycle, which is also basically a Krebs cycle and urea cycle. सर ये सब क्वेश्चन आते हैं कि भाई ये प्रीवियस ईयर क्वेश्चन है. इट इज वेरी वेरी फेवरेट क्वेश्चन. विच अकर्स वेयर, ये पूछने का. ठीक है, सो जल्दी बताइए. विच अकर्स ओनली इन द साइटोप्लाज्म. यहाँ पे ध्यान दो, ओनली इन द साइटोप्लाज्म. चलिए. So I'm looking, all of you are absolutely correct. Pratyusha, Rinkesh, Anuj, Pooja, Krish, all of you are absolutely correct. What is the reaction which takes place only in the cytoplasm? Glycolysis. कौन होता है? Glycolysis. But इतने में नहीं हो पाएगा, तो हम लोगों को जानना चाहिए. What is that? What is that we need to know? We must know one thing. What is that? That is your, yes, please listen to me. All the cycle. पहले तो glycolysis. So glycolysis होता है only in the cytoplasm. Okay, then your beta oxidation. Okay, beta oxidation, my dear students, starts होता है. Start is not a अच्छा word. बीटा ऑक्सीडेशन का इनिशिएशन और एक्टिवेशन शुरू होता है कहां पे? activation starts in your what is that is in your cytoplasm. But if beta oxidation proper पूछ दिया, beta oxidation proper, ऑक्सीडेशन रिएक्शन प्रॉपर कहां पे होता है? ये गलती नहीं करना है. बीटा ऑक्सीडेशन प्रॉपर अकर्स ऑलवेज इन द माइटोकॉन्ड्रिया. कोई गलत नहीं करेगा. माइटोकॉन्ड्रियन. ओके, माइटोकॉन्ड्रियन. ओके, let's continue to the next important, that is your tricyclic acid cycle. TCA cycle, that is your Krebs cycle, occurs exclusively in the mitochondria. Please do not get confused. Okay, beta oxidation starts in, what is that? Starts in this place. That's it. Okay, now let's go to the next one, urea cycle. यूरिया साइकिल कहां पे होता है? यूरिया साइकिल स्टार्ट होता है, स्टार्ट इन द माइटोकॉन्ड्रिया एंड लेटर कहां शुरू होता है? माइटोकॉन्ड्रिया. लेटर इट विल गो टू द साइटोप्लाज्म. तो यूरिया साइकिल आल्सो बोथ द प्लेसेस. एंड हीम सिंथेसिस कहां पे होता है? heme synthesis both the cytoplasm and mitochondria. In both cytoplasm and mitochondria the reactions will occur. The locations of the reactions are very important. Glycolysis, beta oxidation, tricyclic acid cycle, urea cycle and heme synthesis. Okay, चलिए ANP acts through चलो बताओ ANP acts through what? ANP stands for atrial natriuretic peptide. What is that? Atrial natriuretic peptide. I think somebody had answered this ANP का question. Somebody earlier had answered in the comment. मैंने देखा था उस चीज को, तभी मैंने already question आएगा आगे करके मैं चुपता तभी. So atrial natriuretic peptide. Okay, so atrial natriuretic peptide produced from कहां से आता है? Where does the atrial natriuretic peptide is being produced? The atrial natriuretic peptide is produced from your heart, specifically atria. So whenever we are speaking of atrial natriuretic peptide, you people are absolutely correct. It acts through CGMP. All of you are correct. What is that? Answer is A. पर यहाँ पे देखते हैं, ध्यान से सुनो. अरे आएगा क्या? What will be there? That will be your, what is that? From the heart. ये like you know इसका when it will be produced, when it is produced, whenever there is a increase of volume, if there is a increase of circulatory volume. Action क्या करता है sir? ये action, yes, it will cause the loss of sodium. कौन से ऐसा हार्मोन था which was प्रोटेक्टिंग द सोडियम? एस aldosterone सोडियम को अंदर रोकना चाहता है, बट ज्यादा सोडियम हो जाएगा तो ये इन पे आएगा, अरे गधा क्या कर रहा है तू? इतना सोडियम करके हार्ट के ऊपर स्ट्रेच कर रहा है. तो अब आ जाता है कौन? एन पे के व्हाट विल ही डू? हे कम ऑन, गेट आउट. हु इज दैट? Na will be gone out from your, what is that? Action of natriuretic peptide. Okay, atrial natriuretic peptide, loss of sodium कभी भी बाहर जाएगा, it will take water with it sir. Okay, PDF तुम्हारा PDF at the end of the class what we will do is, today we will finish the class. After finishing the class I will tag this PDF in the description of the same video. Okay, कल वाली वीडियो में आके बायोकेम का नहीं मिलेगा, आज वाले का जो भी होगा, आज का वीडियो वापस आके चैनल पे ही रहेगा ना. वीडियो का डिस्क्रिप्शन बॉक्स में जाओ, गूगल ड्राइव का लिंक रहेगा, लिंक को डाउनलोड कीजिए, लिंक को ओपन करके डाउनलोड कर लो, आपको PDF मिल जाएगा. ओके, प्लेलिस्ट. Okay, got the answer for PDF? All right. So action will be loss of H2O and sodium. So it action, secondary messenger कौन होता है इसका? Secondary messenger is your, all of you said already, CGMP. No problem. चलिए आगे बढ़ते हैं. Let's go to the next important, tyrosine kinase के through. Tyrosine kinase यहाँ पे दिया हुआ है कौन? Tyrosine kinase के through acting substances. Which are those? Tyrosine kinase के through acting substances, the three hormones. One is your prolactin, okay, one more is your insulin and your growth hormone. यहाँ पे लिख लो not glucagon. All of the following except पूछेगा, हम तो बढ़ा देंगे आप लोगों को. याद रखो बच्चों, क्या होता है? पिग. क्या होता है? पिग. आप लोग भी निमोनिक को रट लिया, पिग. टायरोसिन काइनेस. वहां जाने के बाद अब ऑप्शन में दिया हुआ है ग्लूकोगॉन एंड ग्रोथ हार्मोन. अब हमें खुद को लगेगा अरे हम तो गलती से पिग तो नहीं बन गए. व्हाई? बिकॉज ग्रोथ हार्मोन ग्लूकोगॉन वहां पे कंफ्यूज करेगा. तो यहां पे क्लैरिटी दे देता हूं, नॉट ग्लूकोगॉन. ओके, नॉट ग्लूकोगॉन. थैंक यू. चलिए आगे बढ़ते हैं. वेरी गुड यार. ओके, IP3 एंड DAG CAMP का कोई पूछेगा नहीं, वही पूछेगा नहीं, अरे कहीं पे भी जाओ CAMP बनता है, कहीं पे भी जाओ IP3 बनता है. A lot of receptor works with IP3 and CAMP, they cannot ask, but there are some places where it is working very specifically, so that is why they will ask you. Okay, चलिए आगे बढ़ते हैं. Peripheral conversion of T4 to T3 is done by which enzyme? Okay, which enzyme? So पहले तो ये देखो peripheral conversion of T4 to T3 होता क्या है? This was a recently asked question, very recently asked question. So चलिए आंसर बताओ. चलो चलो बताओ, आंसर बताओ, लेट्स सी. अरे थैंक यू. सो प्लीज लिसन टू मी. पेरिफेरल कन्वर्शन, तो पेरिफेरल कन्वर्शन समझने के लिए एंजाइम ऑप्शंस पढ़ा देता हूं एक बार. थायरोसिनेस, थायराइड पेरोक्सिडेज, डीएमिनेस, डीआयोडीनेस. तो इसके अंदर से योर डॉक्टर चैंटिंग डॉक्टर पारस इज हियर, तो वी वेलकम यू. एंड पारस भाई, लाइक आवर स्टूडेंट्स को दे हैव बीन लाइक ये बहुत एक्टिवेट हो गए. मुझे लगता है तुम्हारा चैंटिंग का इफेक्ट है, नहीं तो अर्लियर लाइफ में इतना एक्टिव नहीं होते थे. ये तो तुम्हारे लिए कॉम्प्लीमेंट है, सीरियसली. चलो लेट्स कंटिन्यू. पेरिफेरल कन्वर्शन ऑफ T4 टू T3. द आंसर इज, कितने लोग बी बोले वो बी गलत आंसर. ओके, द आंसर इज डी आयोडीनेस. पहले तो एक बात समझो. सो व्हेन वी आर टॉकिंग ऑफ सीरम, okay, when we are talking of serum in the blood vessel, the level of T4, the quantity of T4 is more than T3. Quantity of T4 is more than T3. So when T3 is needed, when T3 is needed, so that time in the blood this T4 will get converted into T3. T4 will get converted into T3. Okay, so T4 to T3 conversion, basically I am removing with iodine, so this is only called as deiodinase. What is it called? Deiodinase. What is it called? Deiodinase. So deiodinase, this deiodinase is there, right? Deiodinase. तो गलती से अगर यार हम फंसना नहीं चाहिए ना, तो एग्जामिनर पूछ लेगा तो लास्ट टाइम डीआयोडीनेस का इफेक्ट पूछा है, तो नेक्स्ट टाइम ही कैन आस्क यू रादर देन द इफेक्ट पूछने से ही कैन आस्क यू व्हाट इज दैट टाइप्स ऑफ डीआयोडीनेस. अगर पूछ लो भाई क्या दिक्कत है, हम पढ़ा देंगे, क्यों टेंशन. सो डीआयोडीनेस कैन बी डिवाइडेड इनटू आइसोएंजाइम्स. आइसोएंजाइम्स, ओके, आइसोएंजाइम्स D1, D2 एंड D3. ओके, अब D1, D2, D3. सो D1 बनाता है तुम्हारा T3, D1 बनाता है तुम्हारा T3, ठीक है सर. ओके, देन योर T2 बनाता है one is your T3 and one more is your RT3. ओके, एंड D3 बनाता है RT3. इतना याद रखो, RT3 whatever is there, right, it is a inactive substance. It is a inactive substance. So यहाँ पे T3, the active T3 will be formed. This is only useful for us D1 and D2. So this is a story of deiodinase. कहीं पे भी do not make mistakes. Very very common mistake it is. टाइरोसिनेस कहां पे काम आता है? टाइरोसिनेस ये करता क्या है? इट विल प्रोड्यूस मेलानिन. टाइरोसिनेस विल प्रोड्यूस मेलानिन. अगर इसका डेफिशिएंसी होता है तो दैट विल लीड टू your albinism. Thyroid peroxidase, it will produce both of them, both T3 को भी T4 को भी बनाने में मदद करता है, बट कन्वर्शन इज डन बाय योर वेरी इंपॉर्टेंट डीआयोडीनेस. ये सारे चीज आपको पता होना चाहिए. ही कैन आस्क यू फ्रॉम एनीवेयर, सो डू नॉट मेक दिस मिस्टेक, ठीक है. चलो लेट्स कंटिन्यू टू द नेक्स्ट इंपॉर्टेंट एस्पेक्ट. पोस्ट मेनोपॉजल वुमेन प्रेजेंट्स विद द पेन इन द फर्स्ट metatarsophalangeal joint, basically grade 2, following the intake of alcohol. The drug used to treat this condition act by which of the following? Okay, चलिए पहले तो क्वेश्चन का डायग्नोसिस बनाते हैं. व्हाट इज द डायग्नोसिस? कम ऑन क्विकली. So the diagnosis first, she is having what is that? First metatarsophalangeal pain, phalangeal joint pain. So that is only pain in the great toe. ये शुरू कब हुआ था? That is done after, what is that? That is done after intake of alcohol. After the intake of alcohol. So this is a case of gout, sir. Case of gout. Gout का treatment क्या देते हो? Usually we are going to give, what is that? We are going to give NSAIDs and allopurinol. So allopurinol will inhibit which enzyme? हाँ, एलोपिरनल इनहिबिट xanthine ऑक्सीडेज। अभी तो पढ़ाया, आप लोग गलती न मत करो प्लीज, डू नॉट मेक द मिस्टेक, ध्यान से पढ़ना चाहिए क्वेश्चन को। आंसर इज xanthine ऑक्सीडेज। हो गया, xanthine oxidase. Allopurinol is there. Okay, HGPRT, where it will come? Leishman syndrome. Thymidylate synthase, it will synthesize the thymidine. Okay, it is responsible for the pyrimidine synthesis. 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 Okay, all right, pyrimidine synthesis. Okay, all right, adenosine deaminase कहाँ पे काम आता है? Adenosine deaminase plays a role in the breakdown of purine metabolism. Adenosine deaminase is breakdown in the purine metabolism. हो गया, all the enzymes done. चलो, the answer is xanthine oxidase. चलिए आगे बढ़ते हैं, लेट्स गो टू द नेक्स्ट क्वेश्चन. व्हाट हैपेंस आफ्टर ए मील? अगर फूड लोगे, खाना खाओगे तो क्या होगा? अब ये सिंपल क्वेश्चन है, बहुत सिंपल क्वेश्चन है, तो आप लोग वेरी इजीली शुड बी एबल टू आंसर. चलो ध्यान से पढ़ो क्वेश्चन को. सो मील खाओगे, मील से क्या आएगा? पहले आंसर बता दो. मील खाओगे, मील से क्या आएगा? मील से you'll get the glucose. Meal से you'll get the glucose. Now glucose will be taken by beta cell, taken by beta cell of the pancreas. Beta cell of the pancreas. चलो आंसर देखते हैं. All of you are telling insulin increase होता है, ग्लूकोगन कम होता है. That is a correct answer. Answer is ये. बट कैसा होता है ये भी देखो, ये बहुत बच्चों को कंफ्यूज करता है, मैंने सुना हुआ ऐसा. So pancreatic beta cell taken by the pancreatic beta cell with the help of glucose transporter 2. Now this glucose transporter 2 के बाद क्या करता है? Pancreatic beta cell will produce insulin. Okay, insulin will go and act upon what? Act on the glucose transporter 4. Basically glucose transporter 4 will uptake the glucose. Okay, so this is how it will work. तो इंसुलिन डिपेंड, इंसुलिन के ऊपर मतलब इंसुलिन से काम करने वाला which glucose transporter works by insulin? It works by the insulin GLUT4. Which glucose transporter will release the insulin? Glucose transporter 2. ये दोनों क्वेश्चन पहले पूछा गया. So all of you are correct. So what will happen? Increase of insulin and decrease of glucagon. Okay, अगर blood sugar if it is reduced, glucagon बढ़ेगा. Okay, let's talk about the next disease. Menkes disease is caused by what? Okay, options are copper deficiency, options are copper toxicity, zinc deficiency, fluorine excess. So Menkes disease में क्या होता है? जल्दी बता दो आप सर. So Menkes disease is a type of genetic disorder. Yes, it is a genetic disorder which is caused by mutation of a particular gene. So we will talk about that. First, quickly give me the answer. Menkes disease is caused by the deficiency of. Yes, waiting for your answers. So all of you are correct. The answer is very good. Menkes disease caused by, yes, the answer is copper deficiency. So कॉपर के ऊपर से दो डिसीज होता है. कॉपर के बेसिस में 2 डिसीजेस आते हैं. एक मेंकेस होता है, एक विल्सन डिसीज होता है. लेट्स टॉक अबाउट द मेंकेस एंड विल्सन डिसीज. विल्सन डिसीज एंड मेंकेस, इट इज caused by the mutation of ATP gene. What is that called? By mutation of ATP gene. Wilson disease also caused by mutation of ATP gene only. ATP7A deficiency and Wilson is ATP7B deficiency, defect of 7B gene. Okay, not deficiency, gene defect. Okay, ATP7A and ATP7B. So in the Menkes disease there is a decrease of copper. Okay, and in the Wilson disease there is a decrease of ceruloplasmin. Okay, decrease of ceruloplasmin. Ceruloplasmin is a plasma protein जिसका काम होता क्या है सर? Ceruloplasmin का काम होता है, it is responsible for our, that is transport of copper. Okay, करवा देंगे, वो भी करवा देंगे, कोई दिक्कत नहीं। बायोकेम का नीट पीजी के लिए करवाना है, वो भी करवा देंगे, डोंट वरी। सो नाउ दिस रिकॉल क्वेश्चंस वी आर यूजिंग फ्रॉम बोथ नीट आल्सो एंड एफएमजी आल्सो। ओके, सेरिलोप्लाज्मिन कम होगा, सेरिलोप्लाज्मिन कम होने की वजह से देयर इज नो कॉपर ट्रांसपोर्ट, no copper transport. If there is no copper transport, then it will lead to what is that? It will lead to accumulation of copper, that such as the hepatitis, that is the hepatic cirrhosis. So hepatic cirrhosis हो सकता है. Along with hepatic cirrhosis, patient can have hepatolenticular degeneration, hepatolenticular degeneration, hepatolenticular degeneration, and along with the hepatolenticular degeneration, patient can also have one of the most important thing, that is a KF ring. What is that? KF ring. Okay, वहां पे जाके KF ring मतलब kingfisher ring मत बोल देना. It is not a kingfisher ring. It is called as a Kaiser-Foster ring. Okay, KF पढ़ के गए थे तो वहां पे फुल फॉर्म दे दिया, हम ढूंढ रहे किंगफिशर के लिए. वो किंगफिशर रिंग नहीं होता है सर. दैट विल बी व्हाट इज दैट? दैट विल बी काइजर-फस्टर रिंग. ओके, आंखों में होता है. व्हाट इज दैट? काइजर-फस्टर रिंग. ओके, व्हाट इज द ड्रग ऑफ चॉइस? चलो, ड्रग ऑफ चॉइस ये भी पूछा गया है पहले. सो ड्रग ऑफ चॉइस इज द पेनिसिलामाइन. व्हाट इज द नेम ऑफ द ड्रग? पेनिसिलामाइन. ओके, so penicillamine, and here पे copper deficiency will be there in the Menkes disease. Menkes disease patient will have a, what is that? That is most important, kinky hair. Menky kinky. Okay, menky kinky. Okay, okay, chinky nahi hai bhai, minky and kinky. Okay, so that is only your, what is that? That is your Menkes disease. Okay, all right, very good, very nice. All of you are correct. Let's go to the next important aspect, the next question. चलो देखते हैं. ये बहुत easy question है यार, ये इतना आसान question तो मैं कभी नहीं देखता. Yes, you are absolutely correct. That is your penicillamine is the answer. Okay, चलिए. A person presents with diarrhea, dementia, dermatitis. What is the probable cause? Yes, Kaiser Flusher. Okay, so that change the spelling. I'm sorry for that. हो जाता है कभी कभी, गलती से मिस्टेक. चलो चलो बताओ. A person presents with diarrhea, dementia, dermatitis. What is the probable cause? Pellagra, cystinuria, alkaptonuria, porphyria. So all of you know 4D disease. What is that? 4D disease. What is that? 4D disease. That is called as pellagra. That is called as pellagra. Pellagra. What is pellagra? 4Ds. Diarrhea, dementia, dermatitis. Diarrhea, dementia, dermatitis. So these 4Ds are, what is that? That is your clinical features of pellagra. Pellagra will occur as a result of deficiency of which vitamin? Deficiency of niacin. Deficiency of which vitamin? Niacin. Which vitamin? Niacin. Okay, which vitamin? Niacin. Okay, what is that? Niacin. Okay, so B3 deficiency, niacin, which is a B3 deficiency, and this can also be seen with the same, that can also be occur as a result of Hartnupp's disease. What is that? Hartnupp's disease. What is that? Hartnupp's disease. Hartnup disease में होता क्या है? एक अमाइनो एसिड होता है. There is a decrease of tryptophan. Sir, there is a decrease of tryptophan. There is a decrease of tryptophan. So ये tryptophan के अंदर, now this tryptophan deficiency will lead to what? Tryptophan deficiency will decrease the vitamin B3. Will decrease the vitamin B3. Why? Because your tryptophan amino acid required for the production of what? Niacin. Niacin production के लिए कौन चाहिए? As your, that is your what is that? Tryptophan. ठीक है. तो यहाँ पे देखो, so the patient will come to you with dermatitis, and also patient will also have Casal necklace. What is that? Casal necklace. Casal necklace. So this is a Casal necklace around the neck, as if like a necklace. There is a appearance of dermatitis. There is a dermatitis. Okay. So maize and jawar eaters, and if their main diet is only that, then it can appear. Okay. Chaliye, let's go to the next one. A vegetarian patient presents with anemia and hypersegmented neutrophil. What is the most probable cause? What is the most probable cause? So the option include option A, megaloblastic anemia, option B, iron deficiency anemia, anemia of chronic disease, and sideroblastic anemia. What is that? Sideroblastic anemia. So let's see the what is the answer. Come on, tell me the answer quickly. What are all the clinical feature? यहाँ पे देखो क्या दिखा है, हाइपर सेगमेंटेड न्यूट्रोफिल. मैं अभी थोड़ी देर पहले पढ़ाया था, हाइपर सेगमेंटेड न्यूट्रोफिल्स आर सीन विथ व्हाट इज दैट, मेगालोब्लास्टिक अनेमियास. ओके, ऑल राइट. So this is a vegetarian patient with a megaloblastic anemia. Likely it is a B12 deficiency. B12 deficiency. So B12 deficiency में आएगा कौन सी anemia? Option A, megaloblastic anemia. Okay, so anemia of iron deficiency anemia, remember it is a type of microcytic anemia. Anemia of chronic disease also a type of microcytic. सिडरोब्लास्टिक anemia can present as both. what is that, microcyte भी आ सकता है इसमें and macrocytes भी आ सकते हैं. And sideroblastic anemia usually seen with vitamin B6 deficiency. Vitamin B6 deficiency. Sideroblastic anemia can be seen with B6 deficiency. It can be both micro and macro. So anemia of chronic disease and iron deficiency anemia, इन दोनों के अंदर भी आप लोगों को याद रखो, anemia of chronic disease. What is that? Anemia of chronic disease. We use TIBC levels to check the TIBC. Iron deficiency in anemia of chronic disease, there can be normal total iron binding capacity. Okay, but in iron deficiency there is an increase of TIBC, and here there will be normal or even decrease of total iron binding capacity. TIBC कम हो गया तो anemia of chronic disease, total iron binding capacity TIBC sorry, I said correctly, wrote wrongly. TIBC बढ़ेगा, total iron binding capacity is increased with the iron deficiency anemia. Change it. Total iron binding capacity increase with iron deficiency anemia. And in anemia of chronic diseases, it will be decreased. Anemia of chronic disease caused due to a molecule will be produced called as hepcidin. What is that? Hepcidin is produced as a result of chronic inflammation. Chronic inflammation होगा तो तुम्हारा liver क्या बनाएगा? Hepcidin बनाएगा. Hepcidin जाके क्या करेगा? This fellow will inhibit iron absorption. हो गया? Anemia of chronic disease and iron deficiency anemia. Okay. So only non-veg eater develop 6 deficiency sideroblastic anemia. No, there is no conclusive proof for that, so don't remember like that. Okay, only non-veg, no, there is no conclusive proof for that. Chalo, let's go to the next one. The micronutrient that deficient following the post-ileal resection. Option A, B12, option B, folate, option C, iron, option D, copper. What is the answer? Yes. What is the answer? Come on, quickly tell me. Micronutrient that is deficient. So क्या हो गया? पोस्ट आइलियल रिसेक्शन. तो क्या कर दिए सर? आइलियम को हमने हटा दिए. क्या कर दिए? आइलियम इज रिमूव्ड. So among the given option, which one is absorbed in ileum? Okay, so चलिए. So iron is absorbed in duodenum. Iron is absorbed in the duodenum. Copper also in the duodenum only. Folate is absorbed in the jejunum. Okay, and B12 is absorbed. Exactly, very good, all of you are correct. The answer is A. Yes, very nice, all of you are correct, guys. What is that? B12 deficiency. B12 is absorbed from the ileum. Okay, so अगर ileum को ही तुमने हटा दिए तो क्या होगा? B12 absorption नहीं होगा. Okay, so this can occur in Crohn's disease also, post-ileal resection also. Yes, this can occur post-ileal resection even in the Crohn's disease. Yes, in the Crohn's disease also it can occur. Okay, so that is the story of your what is that? B12 deficiency. And B12 deficiency can occur. B12 deficiency can occur even when deficiency can occur even during what is that? Autoimmune gastritis. That is your type A gastritis. So in the type A gastritis also B12 deficiency will occur, because type A gastritis may destruction of the parietal cell. Okay, डिस्ट्रक्शन ऑफ द पेराइटल सेल. अगर पेराइटल सेल डिस्ट्रॉय हो जाता है तो क्या होगा? देयर इज ए डिक्रीज ऑफ intrinsic factor. There is a decrease of intrinsic factor. Since there is a decrease of intrinsic factor, that will lead to decrease of B12 absorption. क्योंकि absorption of B12 will need that is intrinsic factor जो आता है parietal cells से, but parietal cells are damaged in a type A gastritis. अच्छा, फोलेट फूफा, ओके, जेजुनम जीजा, ओके, फूफा और जीजा, वाह, वेरी नाइस निमोनिक, फूफा और जीजा. सो फोलेट फॉर फूफा, जेजुनम फॉर जीजा, ओके. सो वेरी नाइस वर्क, ओके. चलो, एवरीबॉडी क्लियर विद दिस क्वेश्चन? आई एम होपिंग दैट. लेट्स कंटिन्यू टू द नेक्स्ट क्वेश्चन. चलिए ये क्वेश्चन को आंसर करो मुझे. A person has a history of alcoholism for 20 years. He avoids alcohol for 2 days. अरे ये तो permanent drinker, professional drinker है बंदा, है ना? So he's a professional drinker for how long? 20 years. He stopped the alcohol for 2 days and present with agitation, global confusion, disorientation, hallucination, fever, high BP, diaphoresis and autonomic hyperactivity. Autonomic hyperactivity. So what is the diagnosis? तो यहाँ पे एक चीज को देख के आप कंफ्यूज हो जाते हो, ग्लोबल कंफ्यूजन, ओके. यहाँ पे ध्यान से देखो, ये अल्कोहल पीने वक्त हुआ है कि विथड्रॉवल. सो स्टॉप्ड द अल्कोहल, स्टॉप्ड द अल्कोहल. सो अल्कोहल स्टॉप करने के बाद, after stopping of the alcohol, what is happening? Stopping of the alcohol is leading to all these clinical features given in the case. So that time is very clear what is happening. It is a withdrawal of alcohol will lead to delirium tremens, okay. Withdrawal of alcohol will lead to delirium tremens. Wernicke's encephalopathy, आप लोगों को क्या मिलेगा? गोवा. And false filling of memories, confabulations. What is that? Confabulations are seen with your Korsakoff syndrome and pancreatitis. Pancreatitis होता तो abdominal pain लेके आया होता, not with the complaints of disorientation, okay. So this is the story of your delirium tremens. चलिए आगे बढ़ते हैं. Next one, okay. See, ये क्वेश्चन कितने बार रिपीट हुआ है? I'm collected only previous year question and look at this question. Alcoholism का कितने बार रिपीट हुआ है? So many times. So quickly tell me what is that? See, just now we had 3 times we are repeating this question, and all the 3 times it was previously asked question. So understand the importance of this question, okay. So he's having what is that? Global confusion, symptoms of confusion, ophthalmoplegia, ataxia, GOVA. What is that? GOVA. Okay. So this is a classic mnemonic to remember. So that is your, what is that? Wernicke's encephalopathy. Absolutely all of your correct answer. The answer is vitamin B1 deficiency. Vitamin B1 deficiency. So this is the story of your, what is that? A global confusion. See, vitamin B1 deficiency, or which one you want me to explain? Nidhi, you want me to explain this one, vitamin B1 deficiency? The B1 deficiency is what it was due to chronic alcoholism. Chronic alcoholism patient will have, what is that? Decrease of B1 levels. B1 centrally means in the nervous system. B1 level kahan pe kam hota hai? Centrally in the nervous system. Because of that, the person will have global confusion. What is that? Global confusion. Okay, so that is one symptom, and he will also have ophthalmoplegia. Okay, so a defect with the eyes. Okay, and this is ataxia. Okay, so these are the clinical features. And the previous question, it's very simple. He is having alcoholism for 20 years. He stopped for 2 days. After stopping of alcohol, he is getting hallucinations. Pay attention, hallucination, fever, high BP. Okay, hallucination, fever, high BP, and there is no ataxia or also your ophthalmoplegia, but autonomic nervous system is becoming hyperactivity. This is a withdrawal of alcohol called as a delirium tremens. Delirium tremens. Okay, so when you look at Korsakoff syndrome, confabulation आएगा. Wernicke's encephalopathy में ataxia and ophthalmoplegia चाहिए था. Pancreatitis का clinical scenario नहीं है because pancreatitis will come with abdominal. Hope this one is clear. Let's go to the next important question. चलो थोड़ा इधर से उधर से ऐसा क्वेश्चन ट्विस्ट एंड टर्न भी कर लेते हैं. Group of friends planned a trip to Ladakh. One of them is having headache, nausea, dizziness, exhaustion symptoms while they were there. Which of the following is the best course of action? The options are sumatriptan, acetazolamide, scopolamine, and promethazine. Okay, what is the answer? Come on, kill me quickly. So he's having what is that light-headedness and he's getting exhausted when they were in the Ladakh. लद्दाख में क्या होता है सर? हाई एल्टीट्यूड. लद्दाख में क्या है? हाई एल्टीट्यूड. So in the high altitude, patient will get a mountain sickness. Mountain sickness. Okay. Why mountain sickness? Because in a high altitude, there is an increase of respiratory rate. Increase of what? Respiratory rate. And also in the high altitude there will be loss of carbon dioxide. Loss of what is that? Carbon dioxide. So patient will develop not metabolic but respiratory alkalosis. What is that? Respiratory alkalosis. Respiratory alkalosis. So the drug of choice for the mountain sickness, yes, this drug of choice is acetazolamide. Acetazolamide. And examiner can ask you, ये कैसा काम करता है? How does this work? For this, it will inhibit carbonic anhydrase in the lung. Carbonic anhydrase in the lung. And it will decrease the loss of CO2. Acetazolamide will do what? Acetazolamide will decrease the loss of CO2 from the lung. So that is why we are using it in the treatment of mountain sickness. Okay. So the drug of choice is acetazolamide. Acetazolamide. Sumatriptan. Sumatriptan is a drug of choice for migraine attack. Sumatriptan is a drug of choice for migraine attack, not for the prophylaxis, but for the attacks of the migraine. Scopolamine is a drug of choice for motion sickness. For what? Motion sickness. Okay. Now, promethazine also used in motion sickness. Promethazine also used in motion sickness, but most important drug is drug of choice is that is your scopolamine. Okay, so all the 4 drugs. See, the thing is, we think that it works only in the kidney. It does not work only in the kidney. Also, it will work in the respiratory tract. तो हम लोगों को सिर्फ हम PCT करके रह जाएंगे ताकि कंफ्यूज हो जाए हम लोग करके ये पूछेगा क्वेश्चन. ठीक है, वो ब्रिलियंट है तो हम नहीं है क्या? हम भी पढ़ा देंगे पहले से ही. Acetazolamide in mountain sickness, the action is in the lungs, not in the kidney, sir. Okay, so I hope it is clear. मतलब उन लोगों को पता है तो हमें भी पता है तो कर. So that is why the confusion should not be there. ठीक है, so it should be very clear. Behind the ear. Okay, a person brought 2 bottles of liquor from the shop and later presented with drowsiness, ataxia, and blurry vision. What will be the antidote? What will be the antidote? Options are your flumazenil. Option B is famipazole and ethyl alcohol. Option C is naloxone. Option D is EDTA. ठीक है, एंड यहाँ पे भी बहुत बच्चे मिस्टेक करने का पॉसिबिलिटीज होते हैं. आई डोंट वांट एनी ऑफ यू टू डू द मिस्टेक. फर्स्ट टेल मी. ओके, कनिष्का and Anuj Sharma says Rinkesh. Okay, the answer is B. Okay, yes, you people are absolutely correct. Answer is famipazole or ethyl alcohol. Famipazole or ethyl alcohol, and this is a case of methanol overdose. मतलब adulterated alcohol. This is a story of methanol overdose. It is a case of methanol overdose. कोई confusion नहीं रहना चाहिए. It is a case of methanol overdose. ठीक है, तो अब पढ़ते हैं तुम लोगों का जॉनी वॉकर का मेटाबॉलिज्म. ओके, सो जितने भी जॉनी वॉकर, whatever your favorite brands, whatever you drink, so how your body will metabolize the alcohol, let me teach you people. Okay, so what exactly happens? For example, a person drinks ethanol. Person drinks, what is that? Ethanol. Okay. Now this ethanol, my dear student, will get converted into one most important acetaldehyde. What is that? Acetaldehyde. What is that? Acetaldehyde. So this conversion of ethanol to acetaldehyde is done by an enzyme called as alcohol dehydrogenase. Alcohol dehydrogenase. Okay, so somebody says their brand is Hagermaster. Okay, so anything you drink. Okay, that's what this is how the metabolism happens. This acetaldehyde will get converted into acetoacetate by the help of an enzyme called as acetaldehyde. What is that? Acetaldehyde. Acetaldehyde dehydrogenase. Dehydrogenase. acetaldehyde dehydrogenase. ठीक है. अगर किसी ने क्या हो गया, लॉकडाउन का टाइम था, मान के चलो लॉकडाउन में आप लोग सैनिटाइजर तो नहीं पी गए ना. Still, if somebody wanted to drink alcohol, they did not drink sanitizer. Why? Because it is dangerous. Why it is dangerous? Now we will learn. Okay. So we have methanol, right? We have methanol. Methanol is basically used as a, what is that? A cleaning agent, antiseptic agent, basically. Okay. It is used as what? Antiseptic agent. So in this methanol, my dear students, methanol will undergo the effect of one enzyme, the same enzyme, alcohol dehydrogenase. Alcohol dehydrogenase. So this alcohol dehydrogenase will convert the methanol into formaldehyde. What is that? Formaldehyde. Okay. Formaldehyde. Now this formaldehyde, under the influence of an enzyme called as formaldehyde dehydrogenase. Formaldehyde dehydrogenase, what will it get converted into? It will get converted into formic acid. Will get converted into what? Formic acid. Now this formic acid is the culprit because it will cause blindness. It will cause blindness. So that is why methanol is dangerous in the usage of, what is that? In the usage of drinking it or mixing it into the alcohols. Drinking alcohols, we should not mix methanol. So if adulteration of alcohol is there, we call it, in the forensic science they have a name called as hooch tragedy. Okay, क्या होता है? hooch tragedy बोलते हैं. hooch. Okay, hooch tragedy. ठीक है. So now जितने भी तुम्हारा एंटीडॉट्स है, फॉर एग्जांपल your methanol overdose, yes, you are going to use either ethanol, okay, or you are going to use, what is that? Famipazole. What is that? Famipazole and ethanol. So ethanol क्या करेगा? ethanol, so अगर patient drank methyl alcohol, now you give him ethanol. Now ethanol will compete with methyl alcohol. मतलब methyl alcohol भी same enzyme के लिए लड़ेगा. methyl alcohol also fight for alcohol dehydrogenase and ethanol will also fight for alcohol dehydrogenase. दोनों, both of them fighting for the same enzyme. You give more amount of ethanol, automatically all the enzyme will get diverted to the ethyl alcohol ethanol. अब methanol metabolism नहीं होगा, without getting metabolized अपने आप ऐसे बाहर जाएगा, तो formic acid नहीं बनेगा, तो there is no problem with the blindness. So that is the answer. अगर famipazole देखा जाएगा, तो famipazole will, mechanism of action, it will inhibit one thing called as alcohol dehydrogenase. So if it is inhibiting alcohol dehydrogenase, this can also used in ethanol overdose. Okay, so this is a story of your, what is that? Story of your alcohol dehydrogenase and enzymes. Okay, so very simple. Whenever I'll repeat once again, a patient drank methyl alcohol, methanol overdose will occur. So now methanol, if you leave it like that only, it will form formic acid and lead to blindness. Okay, so as soon as that patient of methanol overdose comes to you, what you are supposed to do is give him a ethyl alcohol or ethanol. If you give ethanol, now both of them will fight for the same enzyme. Ethanol also want to bind to alcohol dehydrogenase and also methanol. Now during this competition, if you give little more amount of ethanol, okay, now ethanol, the amount of ethanol is more than methanol. If there is more of ethyl alcohol, now alcohol dehydrogenase will not show interest towards the methanol, but rather it will show the interest towards ethyl alcohol. Now the enzyme will shift its action towards ethyl alcohol. So now methanol metabolism will not take place. Methanol will get eliminated from the body. So if methanol gets eliminated, there is no formic acid. If there is no formic acid, no blindness. That is the rationale of giving ethyl alcohol in the overdose of methanol. Basically, enzyme competition. Clear? Okay, hope now it's clear in English also. And famipazole is also a drug which is used for, what is that? Which is used for ethyl alcohol overdose. Okay, chalo, let's go to the next question. A girl with a habit of eating paint peeled off from the wall. presented with the complaints of acute abdominal pain, on and off, tingling sensation of the limbs, associated with weakness of the limbs. Okay, which of the following enzyme will show the reduced activity in the patient? Reduced activity in the patient. Come on, tell me. So if you're commenting the answer, कभी कभी रुक जाता है यार comments आते आते, फिर पता ही नहीं चलता मुझे. Okay, come on, tell me the answer for this. Let's see. So first and most important, छोटी बच्ची है. So the answer is Rinke says answer is A. बचा वालों भी बताओ. So a girl with the habit of eating the paint peeled from the wall. ये क्या कर रही है छोटी बच्ची? पेंटिंग पील करके खा जाती है. Okay, so that will lead to paints will contain what is that? Lead. Paint will contain what is that? Lead. Okay, now paint will contain the lead, so automatically what is the main action? So the lead will go and inhibit one enzyme. Lead will go and inhibit ALA dehydratase. ALA dehydratase. Okay, it will inhibit an enzyme ALA dehydratase. Okay, so lead poisoning will inhibit the ALA dehydratase. So this ALA dehydratase, अच्छा ऐड आ गया था क्या? ALA dehydratase will have what is that? The effect of inhibition by your lead. So this ALA dehydratase is the enzyme which is present in the heme synthesis. ठीक है, तो heme synthesis के बारे में देखते हैं. So how heme synthesis? Answer is B. Absolutely correct. Answer is B. Okay, so please listen to me. How does heme synthesis occur? So heme synthesis occur both in the mitochondria and this area outside will be cytoplasm. Okay, so whenever heme synthesis has to occur, so you require an amino acid called as glycine. So glycine will combine with succinyl CoA. Glycine will combine with succinyl CoA. Okay, succinyl CoA, and if it combines with the succinyl CoA, we have an enzyme called as aminolevulinic acid. We have an enzyme called as aminolevulinic acid synthase, ALA synthase. We will get ALA, aminolevulinic acid. क्या आता है? ALA, aminolevulinic acid. Aminolevulinic acid will get converted into parfobilinogen, will get converted into parfobilinogen with the help of ALA dehydratase. From there, it will get converted into hydroxymethylbilin. From there, urobilinogen 3, then carbophyrinogen 3. From there, protoporphyrin, and this protoporphyrin will add up Fe2 plus. Will add up Fe2 plus, and after adding the Fe2 plus into the protoporphyrin 9, we will get the heme. सर इतने सारे याद कैसे रहेगा? नाम ही तो हमें अजीबो गरीबो लग रहा है, क्या करें इसको? सो प्लीज लिसन टू मी. मैं जो बताता हूं उसको ध्यान से सुनो. पहली एक इंपॉर्टेंट पॉइंट यू मस्ट रिमेंबर, व्हाट इज द लोकेशन ऑफ हीम सिंथेसिस? अकर्स इन बोथ साइटोप्लाज्म एंड माइटोकॉन्ड्रिया. अकर्स इन बोथ साइटोप्लाज्म एंड mitochondria, and it requires a amino acid. पूछेगा heme synthesis requires which amino acid? Glycine. Okay, now blah 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 blah, all of things are occurring. The last question will be, when does iron will be added into the heme? Heme gets the iron with under the stage of ferrochelatase. What is the name of the enzyme? Ferrochelatase. And lead inhibits both of these enzymes, mainly ALA dehydratase. Lead inhibits what is that? ALA dehydratase. Okay, now that is the next important. What is that? Parfobilinogen deaminase. The deficiency of this enzyme, इसको थोड़ा बाहर करना पड़ेगा. बट अगर किसी को लगता है कि सर हमें ये हीम पाथवे बहुत डिफिकल्ट लगता है, इन लास्ट 2 years हीम पाथवे के ऊपर क्वेश्चन नहीं आए हुए हैं. इट डजंट मीन यू इग्नोर इट एंड गो, जस्ट गो थ्रू वंस at least, since there was not many of the question. Okay, so deficiency of parfobilinogen deaminase will lead to intermittent porphyria. It will lead to intermittent porphyria. Deficiency of urobilinogen decarboxylase will produce porphyria cutanea tarda. Disease का नाम होता है porphyria cutanea tarda. Okay, and for example if Fe3 plus is added, if Fe3 plus is added, then it will not create heme, but rather it will create hemine. Fe3 plus, if Fe3 plus is added, okay, then we will get hemine, not heme. We will get what? Hemine. Okay, so these are the diseases which are associated around this particular aspect. Okay, so once we understood about this, let's go to the next important. Okay, so a patient present to the OPD with well-developed jaundice along with other symptoms. On detailed examination and investigation, patient is provisionally diagnosed with the pancreatic head cancer. Which of the following is not true for the patient? And यहाँ पे ऐसा clinical scenario है. So this is a case of jaundice. This is a case of jaundice. Now in this case of jaundice, what will be there? Okay, decreased urobilinogen in urine, decreased bilirubin in urine, dark yellow colored urine, pale clay colored stool, pale clay colored stool. Which of the following is not true for this patient? Okay, which of the following is not true for this patient? Okay, now listen to me. So you have your, what is that? You have your duodenum, right? And you have the liver. Okay, from the liver you are getting, what is that? A common bile duct, which is formed as a result of cystic duct, hepatic duct, all of them. So this common bile duct will go behind the duodenum and combine with the pancreatic duct and open into the duodenum. Okay, open into the duodenum. Okay, so now what happened? The patient is having a pancreatic head cancer, so it will close the common bile duct. Okay, तो अब bile intestine में आएगा क्या? नहीं आएगा. Bile cannot come into the intestine, so all the bile will remain where? In the liver. From the liver, all the bile and bilirubin, will go to, where is that? Will go to, yes, will go to blood vessel. From the bilirubin, from the blood, it will go to urine. It will go to urine. Okay, so it will go to, what is that? Urine. Okay, which of the following is not true? Let's see. Okay, so if it will go to the urine, in the urine it will go out in the form of, bilirubin. It will go out in the form of bilirubin. Okay, what is that? Bilirubin. Okay, sir, it is, yes, of course it is B. You are absolutely correct, in the form of bilirubin. Okay, which bilirubin? Conjugated bilirubin. Conjugated bilirubin. Which bilirubin? Conjugated bilirubin. Okay, so this is a story of your conjugated bilirubin going. But urobilinogen आता है कब? When it goes from the intestine. When bilirubin goes from the intestine, stercobilin अगर बनेगा, only then urobilin will be there. If stercobilinogen is not there, urobilinogen will not be there. Okay, so which is not true about this patient? Increase of bilirubin will be there. यहाँ पे option में दिया है decrease of bilirubin in the urine. So the answer will be not seen, will be decrease of bilirubin in the urine. It is a type of obstructive jaundice. It is a type of obstructive jaundice. It's a type of obstructive jaundice. In the obstructive jaundice, what will happen is that dark urine will be there. Yes, dark urine will be there, but the feces is not getting any bile. So pale or clay colored stool, okay, and along with that there is a decrease of stercobilin, because stercobilin बनता कब है? Intestine में. अब intestine में bilirubin आया ही नहीं. Into the intestine bilirubin did not come only, so definitely there is no bilirubin will get converted into stercobilin. Means if the intestine gets bilirubin, only then stercobilin will be there. Okay, stercobilin banega, only then urobilinogen will be there. Okay, so decrease of stercobilin. So if there is a stercobilinogen, if it is reduced, automatically bilinogen, if it is reduced, that will lead to reduction of urobilinogen. Okay, urobilinogen. Okay, so this is the story of your, what is that? That is your obstructive jaundice. Obstructive jaundice. In the hemolytic jaundice, unconjugated bilirubin will be elevated. Okay, so that is the story of your, what is that? Story of your bilirubin. Story of your bilirubin. So let's go to the next important. A lady developed a severe hyperglycemia in pregnancy and it returned to normal after the pregnancy with the history of same in her mother and sister. What enzyme is the defective here? Okay, so a patient is having, what is that? Hyperglycemia in the pregnancy. So on the pregnancy, if hyperglycemia is there, which enzyme can be the reason? Come on, tell me. So take a guess. Okay, Rinkesh says it is A. What about the others? Come on, guys, tell me the answer. Okay, don't worry. If you don't know the answer also, it's fine. So the answer is glucokinase. Answer is glucokinase. So in the pregnancy, there is an increase of usually insulin. Increase of insulin, not that much, slight increase. Okay, slight increase of insulin. So because of slight increase of insulin, so there will be increase of glucokinase activity. Glucokinase activity. That is the story. Glucokinase activity. Okay, so glucokinase activity will be slightly raised. Okay, so let's look at this. So insulin will induce the action of glucokinase. It is present only in the liver. Okay, isokinase is present in almost all the tissues of the body, but insulin has no action. This is a direct fact आप लोगों को याद रखना पड़ेगा. That is about exokinase. Okay, so once we are done with this, I am finished with all the important questions. I want you people to just quickly go through few of these things with me. So glucose transporter, and there are some 2-3 small topics are there. I want you to go through, but because every year 100% MCQ. Okay, so since that much important MCQ, we need to go through that every time again and again. Okay, so easily just let's quickly do glucose transporter 1. Glucose transporter 1 located in the RBC and brain and placenta. RBC, brain and placenta. They are active even during hypoglycemia, and it is not a insulin dependent, not dependent on insulin. Not dependent on insulin. Okay, so these questions locations बहुत बार पूछा जाता है. Locations. Okay, glucose transporter 2 is located in the liver and in the pancreas. Which cells of the pancreas? Beta cell. Beta cell से क्या आता है? So very simple. I'll explain. Beta cell say what will come? Insulin will be released. Insulin released by your which one? Glut released by your glucose transporter 2. Abdul, I will explain. Just give me a minute. So glucose transporter 3 is located in the neurons and as well as in your brain. In the neurons and your brain. And GLUT4 is dependent. It is found in adipose tissue, muscle and heart. So it is responsible for, it is activated by insulin. It is activated by insulin. So insulin nahi hai. If insulin is not there, so GLUT4 will not work. So GLUT4, so for its action, for which action? GLUT4's action, we require need. What is that? Insulin. ठीक है. इंसुलिन बनता किससे? GLUT2 से. And इसे किसी से ये होता है? GLUT4. Okay, what is that? GLUT4. Okay, now previous question one more time, very simple. So this is a pregnant female. So in the pregnant female, there is an increased activity of all the hormones. There can be slight increase of what is that? Insulin. So that insulin, what it will do? Insulin increases the activity of glucokinase, That is the reason for developing slight hyperglycemia. It can be found in genetic cases. It is not a very common case. चलिए. So, sir, GLUT2 beta. Okay, beta cells are located, mainly GLUT2 is located in the beta cells of your pancreas. मुझे वो important है, वो चीज को याद रखना ही पड़ेगा. Okay. Then let's go to the next one, sodium glucose transporter. Sodium glucose transporter, they reabsorb. What is that? Reabsorb. What is that? Reabsorb both sodium and glucose together. Sodium and glucose together. So they're located where? SGLT1 is located in the small intestine. SGLT1 is located in the small intestine. SGLT2 is located in the kidney. So SGLT2 inhibitors are used in diabetes mellitus. And also these drugs increase the risk of UTI. Okay, so the drugs we have are canagliflozin and dapagliflozin. ये बहुत बार पूछा हुआ क्वेश्चन है, so I don't want you people to miss this out. ठीक है सर? Then let's talk about hypoxia. Hypoxia के बारे में बहुत बार पूछा गया. so that I have put in everything in 4 to 5 lines only, so that while you are revising you should not face any difficulty. So मैं ये सारे चीज माइंड में रख के आज का मटेरियल बनाया हूँ. So keeping in the mind of what, so on the end moment हमें कितना कंटेंट होता है तो अच्छा होगा. ये मतलब ऐसा चीज काम पे ढूंढने को आपको मुश्किल हो जाएगा, तो फॉर दैट पर्पस कीपिंग इन माइंड दैट इमरजेंसी में ढूंढने के लिए चाहिए आपको करके बनाया हूँ. सो दैट इज व्हाई आई हैव पुट एवरीथिंग इन 1 to 2 lines only. Okay, so hypoxia. Hypoxia is a condition in the atmospheric air. There is a lack of oxygen. In the atmospheric air, there is a lack of oxygen. So because of which hypoxia will occur, which occurs at a high altitude, hemoglobin and RBCs will remain normal. Okay, no problem. Now anemic hypoxia. Anemic hypoxia में क्या होता है? Anemic hypoxia में patient will not have hemoglobin. और क्या होता है, कार्बन मोनोऑक्साइड आके हीमोग्लोबिन के साथ चिपक गया, मतलब देयर इज नो फ्री हीमोग्लोबिन, बिकॉज ऑफ व्हिच हाइपोक्सिया विल अकर. वन इज अनेमिया एंड वन मोर इज कार्बन मोनोऑक्साइड पॉइजनिंग. एंड अनेमिक हाइपोक्सिया, रिमेंबर इन अनेमिक हाइपोक्सिया there is no cyanosis. Direct point, remember, no cyanosis in which hypoxia? Anemic hypoxia. Okay, कार्बन मोनोऑक्साइड पॉइजनिंग का ट्रीटमेंट होता है hyperbaric oxygen. Hyperbaric oxygen. Okay, then we are talking about stagnant hypoxia. So stagnant hypoxia means blood flow नहीं हो रहा है, ischemia हो गया, lack of blood supply. So that is associated with the vascular diseases. What is that? Blood vessel diseases. What is that? Blood vessel related diseases. So there will be, what is that? Problem with the blood flow, hemoglobin, respiratory system and everything are normal. Okay, and tissue hypoxia occurs because of blockade of electron transport chain as a result of cyanide poisoning, or even because of the carbon monoxide poisoning also. But most importantly, I want you to remember that is your histotoxic hypoxia always by electron transport chain inhibitor, cyanide, even your amibarbital, roten, and all of these things will play the role in the histotoxic hypoxia. Okay, then please listen to me. Hereditary fructose intolerance. There is a disease called hereditary fructose intolerance. It is due to deficiency of aldolase B enzyme. Aldolase B enzyme. Which enzyme? Aldolase B enzyme. Hereditary fructose intolerance is due to deficiency of which enzyme? Aldolase B enzyme. Okay, so the gene which is defect, the gene defect is ALDB gene, aldolase B gene. Okay, now essential fructosuria is due to deficiency of fructokinase. So fructokinase, मुझे पता है आप लोगों को confusion होगा, तो यहाँ पे very good Krish, the answer is correct, aldolase B. So that is why I have put everything in one place, ताकि आप लोग like see whenever you are revising, I want you people to make sure this like कभी भी तुम revise कर रहे हो, आज मैंने जो questions पढ़ाया हूँ, जो topics पढ़ाया हूँ, very important topics. Okay, yes, the fructosuria because of fructokinase deficiency. Galactosemia occurs as a result of one enzyme deficiency. The name is called as galactose 1-phosphate. Okay, glucose uridyl transferase. Okay, so the name of the enzyme is galactose 1-phosphate glucouridyl transferase deficiency will lead to what is that? Galactosemia patients will get something called oil drop cataract. What we will get? Oil drop cataract as seen in this image. Oil drop cataract. Okay, so this is the story of your oil drop cataract. And the last thing but not the least thing, we will understand about the collagen defect. So there are types of collagen. So type 1 collagen is located in the ligaments, bone, dermis and tendons. The defect of type 1 collagen will lead to a disease called as osteogenesis imperfecta. So improper development of the bones can occur. That is because of osteogenesis imperfecta. Type 2 is present in the cartilages. Deficiency will lead to chondral dysplasia, less common disorder compared to other ones. And type 3 will lead to what is that? Type 3 will lead to what is that? Ehlers-Danlos syndrome. Type 3 will lead to what? Ehlers-Danlos syndrome. Ehlers-Danlos syndrome क्या होता है sir? What is Ehlers-Danlos syndrome? The patient will have a excessive hyperstretchability of the skin. What is that? Hyperstretchability of the skin, and also having a high risk of aortic aneurysm. And type 4 is located in all the basement membrane. अगर ये defect होगा तो Alport syndrome आएगा. Defect of type 4 will give you Alport syndrome. Patient with Alport syndrome will have a anterior lenticonus, means excessive curvature of the lens, sensory neuronal hearing loss, glomerulonephritis, basket wave appearance if you take a kidney biopsy, and it is a X-linked disorder. Okay, so these are some important aspects which are previously asked also, directly or indirectly, so I don't want any of you to make any mistakes. All right, so this is the story of your biochemistry previous year questions. Hope you people like the session and understood everything. हर रोज every day we keep telling you, you need to keep going, prepare करते रहना and you are not going to stop, your preparation for anything. Do not skip any subject. अगर एक सब्जेक्ट में कुछ भी नहीं आता, मान के चलो सर मैंने एक सब्जेक्ट शुरू किया ही नहीं, okay, so what is that? There is not seen, like तुमने शुरू ही नहीं किया, ऐसा कुछ भी कोई सब्जेक्ट है उसको भी नहीं छोड़ना है. जितना हो सके उतना, एटलीस्ट लिटिल बिट फ्रॉम एवरी सब्जेक्ट, लाइक द सब्जेक्ट व्हिच यू आर लीविंग. अगर तुम छोड़ के जाना चाहते हो, इफ यू आर थिंकिंग टू लीव आउट दैट सब्जेक्ट एंड गो, आई डोंट वांट यू पीपल टू लीव आउट ए फुल सब्जेक्ट, रादर थोड़ा बहुत तो पढ़ के जाना. ठीक है, सो with that much being said, thank you so much guys. So yes, I'm telling, do not leave out any subject. So if you are leaving out a subject, at least little bit, all the important topics discussed in that particular subject go through. Okay, do not go without studying full subject. Without studying full subject, if you go there in the exam hall, you start feeling that all the questions are coming from that subject only, then you will start to panic. So to hold your panic under control, do not leave out a full subject from any side. Got it, Barney Krishna? అర్థమైందా? समझ में आया? पुरिंजता? अर्थ आयता? All right, with that much being said, let's conclude the class here for today. And as I said, for the PDF will be tagged in the description. There will be a drive link. You open the drive link and you can get access to this PDF. That will be done tomorrow. So see you people. फिर मिलते हैं कब? फिर मिलेंगे कल कौन सी सेशन है अपना? फार्माकोलॉजी का प्रीवियस ईयर क्वेश्चंस. ओके, so tomorrow we are meeting up in pharmacology का this thing. Okay, चलो, thank you so much, bye bye, good night, see you people.